Prof.
Selamat pagi, Pak Roni.
Gimana, Prof?
Ya,
Will be great today,
hopefully.
hopefully. Udah ada Dr. Vito nih, Prof Eko. Sudah
Selamat
stand
pagi,
by.
Dr. Vito.
Saking seriusnya 2 devices dia, Prof Eko.
Oke, yang penting connection-nya.
Sampai siapin sendiri. Hello, very good morning, Prof.
Morning, Prof. Eko.
Ya, morning, Prof. Oke. How are you? You very early morning, ya?
Yeah. And by the way, thank you again for inviting.
Yeah, we must welcome. We are very thankful also because it's quite difficult in the Ramadan time to call everyone in the very early morning. Just
Yeah. So hopefully with this ASEAN certificate, we can move around, soon.
Yeah, we work hard for that one. Hopefully people accept today. But if people accept,
correct.
then okay, we can continue. So, Dr. Ronnie, I think this is your assignment really to thank all people to agree on that. It's very difficult for us.
But I thought that we already have a very good idea to be over for all the participants. We really expected or the participant could have the same opinion with us. But again, we open with all the other opinion and perspective, definitely. But still, hopefully, like Professor Eko said, that we do really expect that all the participants will be able to have the same perspective with us, so we can have the policy to be hold together and be implemented in the Asian country.
Yeah, definitely. Prof Eko, I would like to ask questions. Now, when the participating university presenting, the secretariat will be put up the PowerPoint slides?
Dr. Roni maybe can answer, or Dr. Hollis? I think so, Dr. Hollis?
Yes, so Prof, definitely whenever the participant and representative of countries and university presenting about their opinion, there will be slide which is already sent to all.
Just to check, UPM, did you get it? I did personally WhatsApp to Mr. Henry.
Yes, okay. So Dr. Hollis, would you mind to recheck with our back team that will present the files for the representative country to be presented for this afternoon?
Okay, all right. Just to check whether UPM is there or not. Thank you very much for that.
Dr. Hollis received
already.
Already, Henry. Thank you, Henry.
Yeah.
Thank you.
Thank you. So confirm, Prof. Thank you. So, Prof, how is the situation in Malaysia? The case is still increasing day by day.
You are talking to me or Prof Eko?
I think to representative.
Yeah.
Prof Sami.
Prof Sami, yes. Sorry, I didn't call by name. Sorry. Yes. So I asking to you, Prof Sami, in Malaysia, how is the situation of COVID-19 today?
Well, it's fluctuating. Now we have almost 2,000 plus cases every day. So it's quite difficult to, bring the R0 below 1. It's quite difficult right now because of the bazaar, bazaar Ramadan. And then we have another school are already open, and then university are also open. A great mobility, I would say. And then people are going to the mall. Hari Raya is coming soon. So everybody is still on mobile, you see.
Yeah, in Indonesia there is regulation that prohibited people move from city to city. So there is a specific regulation today, Prof. Sami.
Yeah, but I think the worst now is in India, right?
Yeah. Just today morning, our government released a new statement that all the citizens of India is prohibited to come to Indonesia for temporary.
Yeah. They have 300,000 cases a day.
Wow, it's like a tsunami cases.
Yeah, it's like tsunami.
So here we have already Dr. Julia. Hello, good morning, Dr. Julia from ASEAN.
Julia, good morning, Dr. Julia.
Good morning, Dr. Julia. I'm still muted, I think.
Hi, good morning, everyone.
Yeah,
Good
I hear
morning,
you.
Dr. Julia.
Good morning.
Morning.
I think
So I see Ronnie. I think there I see Professor Eko, yeah?
Yeah. Okay, we'll come back to our seminar again. I think you will be many time call during this identity COVID.
Yeah. Just sincere apologies from my Deputy Secretary General, Mr. Satvinder Singh. He's unable to join, even though I know he earlier has sent his reply, because we are very busy with the summit today.
Oh, okay.
The
You have
special summit.
ASEAN summit today, the leader.
Yes,
Yeah.
yeah.
Okay.
In this afternoon, so he's involved in that.
But that was not virtual. That was there will be physically meeting.
It's physical meeting, but
Physical meeting. Okay. It's good
in
sign.
this room, there's already Dr. Sunil in this room.
Okay. Hello.
Morning,
good morning,
Dr.
Dr.
Sunil.
Bal.
Morning.
Good morning. Good morning. Good morning, everybody.
Hi, good morning. Very good
morning, Dr. Val.
Yes, very good morning.
How are you, Doc?
Very good.
Okay.
Yeah, I'm okay.
Yeah.
Things not good in India, but I'm okay.
Oh, yeah. Yeah. Things not too good in every nation now.
That's true. Difficult times.
But hopefully soon can be handled, eh? Dr. Bal.
I believe so. I believe so. There is some strategy from India government how to handle the cases. It's not easy, but I think there is some strategic policy. I thought so. Yeah, Prof. Eko, I think Dr. Eddie Fadliana also already in the room.
Oh, okay. Good morning, Dr. Eddie. Are you here?
Good morning, Professor Eko.
Oh, all right. Yeah, welcome again.
Yeah, thank you, thank you.
Good morning, Dr. Eddie.
Good morning. How are you?
Eddie.
Fine.
Good, Doc.
Welcome.
Good morning, everyone.
Oh,
Good
Dr.
morning.
Brian.
Good morning.
Yeah.
Dr. Brian.
Dr. Brian also already here.
Yeah. Sorry, I still cannot, will not turn on the video yet. Just still preparing.
Okay,
Still
no problem,
hiding.
doctor.
Yeah, take your time.
Dr. Vito, thank you, to join us.
My pleasure and an honor. Thank you very much.
Selamat pagi Bu Rektor. Selamat datang Bu.
Selamat pagi, Prof. Rina. Morning.
Pagi, Pak Holis.
Pagi, morning. Can we
Okay, good
start?
morning, everyone. We will start in a matter of seconds. So be prepared for the pen committee. Good morning, everyone, all our respectable guests today, all professors, doctors, and all our invitee, and we all welcome you to this ASEAN ITTP COVID-19 webinar series, and with the main of topic, establish health certificate for traveling within ASEAN countries. Let me introduce myself. I'm Dr. Vito, and we will join this today's seminars. We will be held with the huge challenge currently, but I believe that challenge means opportunity. And this is an international multi-teleconference on technology and policy for supporting implementation of post-COVID-19 new normal in Southeast Asia. Well, actually, this is a platform from academics, industrial experts, consultants, scholars, researchers, government, and policymakers with different backgrounds from different countries. And we actually believe that as one community, one people, one identity in ASEAN, we actually have a huge responsibility as a community in this world to make a huge difference, because we know and we believe that optimistically we will end this, and we will have keynote speakers and then also expert as well. And before we start, I would like to thank all the participants that are attending today, and this event will not possible without the support from, as I already mentioned, Mr. Dante Saxono Harbuono, Mr. Cecep Herawan, Dr. Julia Puspadewi, Dr. Sunil Bal, and Prof. Dr. Rina Indiastuti as host of today's event, and Rector of Universitas Pajajaran. You may give your pulse. And Dr. Eddie Farliana, pediatrician, and Mrs. Yong E. Chin, Prof. Dr. Therawatanon, Yot as speakers, as well as Professor Dr. Mot Ayub Sadik, Dr. Che Chan Yun, Agustin Sumayati, MD, MSc, PhD, Associate Professor Dr. Mot Refi Baharudin, Prof. Dr. Nilar Mientio, Prof. Chenon R. Alfonso, MD, Prof. Theo Yik Ying, and Assistant Professor Dr. Tekreng was situated as country representative. Prof. Rizky Abdullah, Prof. Dr. MD Roslan Hashim, Prof. Dr. Yong Zulani Zubairi, Andika Putra Patrama, steering committee from ITTP COVID-19, to all the scientific committees from ITTP COVID-19, and Dr. Ferdinand Fernando, Dr. Le Guang An, Mr. Larosati Indra Gawagita, Dr. Masaya Kato, Ms. Harifah Sakira, Syed Hamid, Dr. Chong, Che Keong, and Prof. Dr. Kusnandi Rusmil, pediatrician, as special guest. And we know that actually this event are with the support from many university affiliation across the Asian country, Universitas of Indonesia, University Teknologi Malaysia, Universitas Pajajaran, Mahidol University, Vietnam National University, Hanoi, Burafa University, Prince of Songkhla University, De La Salle University, Royal University Phnom Penh, University of Yangon, Universitas Gajah Mada, Ateneo de Manila University, University of the Philippines, University Kebangsaan Malaysia, Institut Teknologi Bandung, University Sains Malaysia, Universitas Brunei Darussalam, University Putra Malaysia, Yangon University of Economic, Universitas Erlangga, National University of Laos, University of Mandalay, University Malaya, Chiang Mai University, Nanyang Technological University, National University of Singapore. Also, we want to thank all the participants today, because believe me that when we have get any idea and any insight, we will make it happen after this. But we need a good strategy, good insight, good perspective, and then we make it with a good plan to have a good result. This webinar today, Establishing Travel Certificate in ASEAN, is organized by ITTP COVID-19 Committee, consisting of 27 top universities from around Southeast Asia. Universitas Pajajaran is the host for this first ASEAN ITTP COVID-19 webinar series. Thank you, Universitas Pajajaran. And the objective of today's webinar is to gather insight and support from various key stakeholders related to background, safe cross-border travel in order to boost the economic recovery into the Southeast region during this COVID-19 pandemic. We know that it's all not too good. I mean, it's not too well for other countries as well as Indonesia. I mean, everyone surely have this common challenge, but we have common opportunities here. And I believe that to accelerate the economic growth, social progress, cultural development, and to have the aim of Asian nation, we have to bring it together. So today agenda will be shown as the committee will be shown the agenda, and then we will have, after the keynote speakers, we will have culmination and conclusion. You may have participate in interactive discussion, and then we have the general report from Prof. Eko as a director of ITTP, and then we will have insight about the vaccine from Dr. Eddie, and then as well as how the impact of travel industries, and then traveling in the Southeast Asian region, and then I think we will find what exactly happened now in our region. So before we start our discussion, may we all stand up, because we will rise for Indonesian national anthem.
Hiduplah
please remain in position. You all can be seated. Okay, it's not easy to gather all the participants, all the experts at one time, but apparently because of virtual meeting, we could gather us along in this very nice event. And then, well, maybe it's one of the positive impact of COVID-19. But anyway, we think that we should give applause for the host, Universitas Pajajaran, and all the committee, because their committed effort to make us have this event today, this morning. And this is a welcoming speech from the host, self Prof. Dr. Rina Indiastuti, MSc. The time is yours, Prof. Rina.
Okay. Thank you, Vito. Very good morning for all. His Excellency Ministry of Health of the Republic of Indonesia. Here kami Vice Ministry, Mr. Dante Saxono Harbuono, and His Excellency Secretary General Ministry of Foreign Affairs of the Republic of Indonesia, Mr. Cecep Herawan, Her Excellency Regional Director WHO Siaro, Dr. Ponem Ketrapal Singh, and His Excellency Deputy Secretary General for ASEAN Economic Community, Mr. Satvinder Singh, the distinguished guest speakers, Dato Dr. Nur Zari Hamad, Professor Dr. Therawat Tanon Yot from HITAP NUS, and Professor Dr. Kusnandi Rusmil, Dr. Aulia Swantika from Universitas Pajajaran, and Ms. Yong I Chin from Malaysia. Dear colleague, Professor Eko Suprianto as ITTP COVID-19 General Chairman, Dr. Brian, Dr. Roni, and all my colleagues, distinguished guests and participants. My name is Rina Indiastuti, Rector Universitas of Pajajaran. It is my pleasure to welcome all eminent speakers, guests, and participants from 8 ASEAN countries to share their knowledge and experience in this prestigious webinar. In an interconnected world, there are any lesson to learn from COVID-19 pandemic. A global crisis requires international cooperation since no single country can overcome this alone. Furthermore, handling the pandemic with its socio-economic impact demands solidarity and action at all levels across the international community. Due to this condition, for the first time, UNPAD is trusted as the host for welcoming all experts from ASEAN to have discussion on health certificate topic through online and digital platforms, including social media ones. Despite this, universities and their communities began to respond to the crisis by doing all they can contribute to the national effort against the outbreak. By collaboration, the university sector has carried out vital role to support the people's health and well-being in this difficult time. Universitas Padjadjaran, as a host of this webinar, as a world university class, always concerned to give most benefit to global society during the COVID-19 pandemic. My campus has been involved in preventing, controlling, and developing innovation to control the outbreak. In 2020, last year, UNPAD launched a Cepat rapid test as one of the screening kit for COVID detection based on antigen detection. Today, Cepat rapid test is approved by authorized and utilized in Indonesia widely. In addition, UNPAD also has been working as leading national clinical test for COVID vaccination. UNPAD welcomes potential collaboration with all universities in ASEAN to utilize this invention to give more benefit in global society. Ladies and gentlemen, this has led a group experts with different background and nationality taking action by proposing action plans involving Southeast Asian countries, which is now called the ITTP COVID-19. ITTP COVID-19 will assemble the experts in the expanding fields related to COVID-19 from very fundamental issues to a new normal practical approach, recovery plan, and its implementation. ITTP COVID-19 has received the support from ASEAN Secretariat and also from AUN Secretariat and 27 leading universities in Southeast Asia to ensure the success of the organization of this initiative. We know that the objectives of ITTP COVID-19 are to build common platform for enhancing ideas and insight on COVID-19 pandemic based on research and experiences to formulate policy recommendations and to identify relevant technologies to support COVID-19 recovery plan. This initiative would also facilitate the implementation of ASEAN Comprehensive Recovery Framework, a consolidated exit strategy for Southeast Asian countries from the COVID-19 crisis devised by ASEAN. ITTP COVID-19 program is a 3-year plan initiative from this year until next 2023, with several programs will be held, including pre-conference webinars today, and then annual conferences, innovation, competition, and joint research. Furthermore, Universitas Padjadjaran always supports facilities to enhance the analytical capacity of academic community and policymakers from local, national, even international level to conduct SDGs in the context of economy affected by pandemic such as tourism, which gets a greater impact than other sectors. Since the start of COVID-19 outbreaks in late 2019, last 2 years, a large number of difficulties and challenges has been faced by tourism sectors in every countries around the world, including of course, Southeast Asia region. It is believed that COVID-19 recovery could not be pursued and solved by within national boundaries, but more broadened international ones, such as Southeast Asian countries' interconnectivity. In order to chart and contribute to a better understanding as the pandemic effect on tourism, current issues in this webinar in tourism is calling for empirically based papers that focus on the impacts of COVID-19 towards market destinations, organizations and businesses, consumers, destination communities, transit zone, and transportation. On behalf of the University of Pajajaran, we highly expect you all to take a part in this ITTP COVID-19 discussion and webinar conference. I wish everyone a successful, safe, and fruitful webinar. Thank you very much. Dito is enough.
Yes, thank you, Prof. Rina. Prof. Rina, you know that Prof. Rina also as well reflects the optimistically of our participants, and not only University of Pajajaran, but all of us, that we can do it together. And then Prof. Rina, I thank you very much for your speech, welcoming speech. We now want to hear and listen and learn very much from our keynote speakers. And then nowadays we realize that this pandemic, COVID-19, is not just about health. And then although we said earlier that this virtual meeting can be held because of this, maybe quote unquote, is one of the positive effects of pandemic, then we do a lot of virtual meeting, and then we can gather all the experts from another nation, maybe in one time, then it's actually maybe save our time and save our money, save financially, I mean, but we still have to travel, and then for active collaboration, and we cannot really just sit ourselves at home. And then, you know, traveling cross country cannot be really deleted from our job and our work. So now we will hear Mr. Cecep Herawan, Secretary General, Ministry of Foreign Affairs of Republic of Indonesia, with the topic of requirements for cross-country traveling. Mr. Cecep Herawan, the time is yours.
Thank you very much, Pak Vito, and a very good morning to all of you, Excellencies, distinguished participants, ladies and gentlemen. First of all, I would like to thank the Professor Eko Supriyanto and the committee of the ITTP COVID-19 for having me here to speak today on requirements for cross-country traveling. Allow me today that I will touch upon three issues. First, on the impact of COVID-19 on cross-country traveling, and second, on how Indonesia's view and mitigate this issue, and third, on facilitating travel during this pandemic. With regard to the impact of COVID-19 on cross-country traveling, we have witnessed how the COVID-19 pandemic has hit Indonesia tourism since 2020, with around 83.26% drop in the number of foreign visitors year to year. Due to the pandemic and subsequent travel restrictions, a total of 2.6 million jobs and 34 million people in tourism and creative economy sector are affected. Almost 90% of the creative economy workers have lost their jobs. The total loss of incurred by Indonesian tourism sector has reached around $730 million. So several tourism destinations in Indonesia, such as Bali, have been hit hardest, with almost 100% drop in the foreign tourist arrivals. Though the world is implementing vaccination program at record speeds, a full and effective restart to international tourism remains challenged by a number of obstacles. Infection rates remain high in some parts of the world, with new variants of the virus spreading fast and creating second and third waves. Strict immigration policies, both for the departures and arrival, are dampening travel demand, as potential travelers need to undergo multiple PCR tests, quarantine procedures, border closures, and on top of that, travelers should also undergo such strict returning home policy, which add cost to their budget. Another issue to highlight is a public trust and awareness towards the adaptability of the tourism destinations, which also needs constant reassuring. In addressing these challenges, we must engage in a comprehensive cooperation involving all the relevant stakeholders. This includes a wide range of measures, such as preparing and implementing a rigid health protocols with end-to-end tracking and tracing platform, encouraging innovation in the implementation, promotion, and marketing of safe travel, investing in the field of digital tourism and creative economy, supporting a short-term financial needs of the local businesses that have been hardest hit, especially SMEs, and working with international partners such as UNWTO and World Travel and Tourism Council to ensure all the work done meets the international golden standard. Excellencies, distinguished participants, ladies and gentlemen, against such backdrops, allow me to share my second point, which is on how Indonesia sees overall implication on this pandemic and how we have adjusted our policies to address the short, long-term impact of the pandemic. In the long term, Indonesia sees great urgency to ensuring that the health sector is immediately strengthened to address the current and also future pandemic by mitigating socio-economic and future impact, as well as by building a self-sufficient and resilient national health sector. In the short term, we sought to ensure national resilience by first securing safe, effective, and affordable vaccines, and second, strengthening global effort to ensure fair, equitable, and timely access to vaccine for all. These are done by facilitating and negotiating access to vaccine through bilateral as well as multilateral tracks with the WHO and Gavi COVAX facilities. In various international forums, Indonesia emphasizes equitable access to COVID-19 vaccines to all, that all countries have the right to fair, affordable, and timely access to vaccine. As conveyed by the Foreign Minister Ibu Retno on various occasions, no one is safe until everyone is. With our active involvement in the multilateral tracks, Indonesia's Foreign Minister has been appointed as one of the 3 co-chairs, along with the Ethiopia and Canada, of the Gavi COVAX Advanced Market Commitment, which seeks to ensure equitable access to vaccine for all. While our foreign policy works actively to explore innovative collaboration at all levels to jointly overcome and mitigate this pandemic, there remains great geopolitical aspect and vaccine nationalism that may hinder and postpone the timing of cross-country travel. For example, some vaccines may be more acceptable for traveling to certain countries. In light of this, we are closely monitoring all development so to ensure that there will be no discrimination towards certain vaccines, that science-based evidence prevail over geopolitical interests, and that any measure related to health passport or vaccine certificate should abide by the international health regulation requirements and a set of parameters agreed by all. Excellencies, distinguished participants, ladies and gentlemen, all those unknowns and uncertainties bring me to the third point, how to facilitate travel during the pandemic. Indonesia underlines the importance of striking a balance between the necessary health and safety measure with the travel-friendly, seamless experience, which would facilitate cross-border travel for essential business travelers with the objective of promoting safe travel. For this purpose, Indonesia has been engaging with various countries in developing travel corridor arrangements with the United Arab Emirates since July 2020, with the Republic Korea since August 2020, and with China since August 2020 as well, and with Singapore since October 2020. Indonesia is also in the process of negotiating a number of other TCAs. Now, regarding the ASEAN TCA, ASEAN leaders have adopted the ASEAN Declaration on an ASEAN Travel Corridor Arrangement Framework during the 37th ASEAN Summit in November 2020. To develop this ASEAN Travel Corridor, ASEAN has established an ad hoc task force in which Indonesia taking the lead on the process by putting on the table a zero draft of the TCA framework work plan. The second out of 6 meetings of the task force will be conducted in the next couple of days on the 26th to 27th of April 2021. Hopefully the TCA would be operational by August 2021 before the 38th ASEAN Summit. This TCA and other travel bubble scheme that we may consider in the future rest upon the principle of ease of travel and safety for all, and by taking full consideration the following. First, the need to ensure that COVID-19 cases are at the downward slope. Second, the creation of mechanism to enable data sharing and mutual recognition of diagnostic results between countries. And third, in conjunction with mass vaccination for health workers and travel tourism industry workers to create health bubbles in major destinations. Excellencies, distinguished participants, ladies and gentlemen, the COVID-19 will not be the last pandemic we see in the region and in the world. It may not even the worst. Indonesia is certainly committed to dealing with the challenges at hand. We are looking ahead to promoting better cooperation and collaboration with all stakeholders in jointly overcome COVID-19 and any future public health emergencies. That way, we will be better prepared and better equipped for any possible future global health crisis. In the meantime, stay healthy, stay strong, and stay united. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Mr. Cecep, because I sense a lot of optimistic there, although that you already say that it's actually there are a lot of challenges. And then I like one of your quote that no one is safe enough before that everybody safe. So no one left behind. And then we are now have the challenge that everybody have to limit their mobility, but we know that maybe for several fields that we do not have any potential if we just stay at home. So this related to our theme for keynote, our later keynote speaker, Dr. Julia Puspa Dewi Tijaja, Director of Asian Integration Monitoring, ASEAN Secretariat, with the topic of impact of COVID-19 to Asian economy. Dr. Julia, the time is yours.
Thank you, Pak Vito, Professor Rina, India Stuti, Dr. Dante Saxono Harbuwono, Pak Cecep Hirawan, Dr. Sunil Bal, Professor Eko Supriyanto, distinguished speakers, ladies and gentlemen. Good morning and very warm greetings from the ASEAN Secretariat. I'm pleased to be here today to deliver these remarks on behalf of Mr. Satvinder Singh, Deputy Secretary General of ASEAN for ASEAN Economic Community. I would focus my intervention today on the impact of COVID-19 on ASEAN economy. So a little bit different from many of speakers here today, but as Professor Rina already mentioned earlier on, the impact of COVID-19 goes way beyond the health sector. Last year, the world economy faced its greatest challenge since the Great Depression. Our lives and livelihood were upended by desynchronized social and mobility restriction. And the impact on the economy has been really devastating. The initial supply chain disruptions were very soon followed by broad-based demand shock. And by the end of last year, the world economy has actually shrunk by 3.3%. Global trade dipped by 5.3%, and foreign direct investment fell by more than 40%, as companies rethink, postpone, or even canceled their investment decisions. Some sectors were hit especially hard: travel and tourism, retail, and other contact-intensive services. And these are the sectors where micro, small, and medium enterprises, women, youth, low-income, and informal workers depend a lot on. Across the world, governments were very quick to roll out monetary and fiscal stimulus, but we know that the fiscal capacity varies greatly across countries, and many of the low-income economies are at risk of that crisis. Our region, ASEAN, was not spared by this economic impact. Although we have weathered the crisis relatively well, performance has been uneven. In 2020, ASEAN GDP contracted also by 3.3%. Almost half of our member states saw their economies contracting by more than 5%, and as deep as 9.5% in the case of Philippines. Only few were able to record moderate growth, with Vietnam being the best performer at 2.9% growth. The region's trade dipped by 5.5%, and the first 3 quarters of 2020, our FDI inflows actually fell by almost a third. Among our trade sectors, as already mentioned, is tourism. This is a significant sector that contributes almost 1/8 to the region's GDP and employ millions of people in our region. International arrivals to ASEAN dipped by more than 80% to just 26 million. In response to this crisis, central banks in the region promptly lowered their policy rates to maintain liquidity and economic stability. Fiscal stimulus and packages were all rolled out, including subsidies to households and businesses. In total, ASEAN fiscal response amounted to around $388 billion, around 1/8 of the region's GDP in the previous year. At the regional level, because as Professor Rina said, this crisis is, you cannot contain this crisis within one economy. Our borders are porous. We need to work together. ASEAN was very quick to commit to keep its market open for both trade and investment, especially to ensure the normal flow of trade for essential products. Following the adoptions of the Hanoi Plan of Action on strengthening ASEAN economic cooperation and supply chain connectivity, ASEAN has signed a memorandum of understanding on the implementation of non-tariff measures on essential goods. Along with this MOU, we have an agreed list of 152 essential products, mostly health-related. Discussions are now underway to expand this list to also include essential food and agricultural products. ASEAN has also set up the COVID-19 ASEAN Response Fund, which is open to contribution from member states, external partners, and the private sector. And the ASEAN Regional Reserve of Medical Supply has also been established, and the work to set up the ASEAN Center for Public Health Emergencies and Emerging Diseases is also underway. Central to the region's recovery effort is the adoption of the ASEAN Comprehensive Recovery Framework, or ACRF, and its implementation plan. This indeed is a region's consolidated exit strategy from the crisis. The ACRF identified 5 priority areas, namely health, human security, intra-regional trade and investment and broader economic integration, inclusive digital transformation, and sustainability. Now, allow me to highlight 5 key areas that are critical for ASEAN economic recovery. First, we need to facilitate the gradual resumption of people mobility, which is the topic of today's webinar. Alongside vaccination rollouts, economies are gradually reopening. It is important to resume people's mobility in the region towards recovery, starting with essential business travels while still maintaining public health and social measures against COVID-19. To facilitate this effort, as Pak Cecep has earlier shared, ASEAN is in the process of discussing the ASEAN Travel Corridor Arrangements Framework and its procedures for delivery within this year. The implementation of this framework will make use of innovative approaches, leveraging on appropriate applied digital technologies. Second, monetary and fiscal stimulus should be continued for as long as necessary, while eventually a gradual and coordinated withdrawal is needed as we have to refocus on restoring fiscal health. Premature and uncoordinated withdrawal of support should be avoided. Third, ASEAN should ensure the entry into force of its key economic agreements so their benefits can be realized. On the top of the list is the Regional Comprehensive Economic Partnership Agreement, which presents a huge market potential as it is one of the world's largest trade blocs. Other key agreements include the ASEAN Trade in Services Agreement and the ASEAN Agreement on Electronic Commerce. Fourth, ASEAN should accelerate its digital transformation in an inclusive manner. Digitalization is an indispensable part of ASEAN recovery strategy. We need to address the digital gap in terms of infrastructure, regulations, and skills across and within countries and across segments of our society. Fifth, ASEAN should leverage on the silver lining from this crisis. By exposing our systemic vulnerabilities, COVID-19 provides us with the opportunity to recalibrate our future to one that is more inclusive and sustainable. A renewed focus on green and low carbon growth is therefore imperative for ASEAN long-term resilience. The region's positive recovery outlook of about 4.9% growth this year remains fragile. We shouldn't take this for granted. This is subject to vaccination and containment success and continued stability in the region. The risk of uneven and differentiated recovery is real, as COVID-19 threatens the reversal of the socio-economic progress that we have made to date. In closing, ASEAN should stay vigilant. The COVID-19 crisis is far from over, but this is not ASEAN's first crisis, nor will it be the last. This unprecedented crisis requires an unprecedented response, with broad stakeholders, including the research community, working hand in hand. By staying united and working together towards recovery, ASEAN, I believe, will come out of this crisis better, stronger, and more resilient. Thank you, and I wish you all productive discussions today.
Thank you, Dr. Julia. It's clear now that, well, this virus not only make us sick, but they are making people poor. You know that it is real, because maybe some of people, they are not afraid of the virus itself. They're rather afraid that they cannot feed their family. So yeah, we know that the impact of this virus for the ASEAN economy is very huge. But now we have another perspective from Dr. Julia, that we can rise, and then we can do it together. And then we will proceed to one of the hottest topic. You know, as the most populous country in ASEAN, we know that Indonesia have also a big challenge. And then we have now national program on COVID-19 vaccination that's still on progress, but many things that maybe we need to hear the perspective from the Vice Minister of Health, Republic of Indonesia itself, Dr. Dante Saxono Harbuono, the internist endocrinologist, PhD. So, Dr. Dante, let's take your time.
Thank you, Vito. Distinguished speaker and participant, ladies and gentlemen, good morning today. And on behalf of the Minister of Health of Indonesia, I would like to thank you to the International Teleconference on Technology and Policy for support implementing of COVID-19 recovery plan in Southeast Asia, for inviting the Ministry of Health to be speaker in this webinar. Ladies and gentlemen, as we know, vaccination is the one of the critical pillar to curb the pandemic. Other than strengthening the diagnosis treatment, public health reform pillars, the government of Indonesia set the target of 70% of population as amount of 181.5 million people to be vaccinated to achieve herd immunity. We start the vaccination program on January 13, and today, at least 11 million Indonesians have been vaccinated. The vaccination rollout plan is based on the President regulation and has three main principles. First, the COVID-19 vaccination is mandatory to free of charge for the citizen. The government bore the expense through the national scheme while the private sector through the Gotong Royong scheme. Second, vulnerable group, those the higher risk of being infected or die from COVID-19 must be vaccinated first, it including frontline health worker and elderly. Third, the public shall abide health protocol, particularly after getting the vaccines. They must wear masks, maintain physical distancing, wash hand, avoid crowd and restrict mobilization. In ensuring access to vaccination for vulnerable group, Indonesia developed a roadmap and technological guideline according of WHO Strategy Advisor Group on Expert or SEGI recommendation on location prioritizing COVID-19 vaccination. It guides us to create two-state vaccination program. From January to June 2021, the first states aim to the high-risk group such as health worker, public servants, and elderly, with total target of around 40 million people. From June 2021 and the end of the year, the second state aimed the people high transmission area and the wider population group, with total target around 141.5 million people. Ladies and gentlemen, before uh, although before rolling out the vaccination, the government has started vaccine campaign since last year. Especially, Minister of Health has developed national communication strategy of COVID-19 vaccine, designed various education media format as a guideline for republishing and modifying the message, and collaborate with mass media and civil society, including religious leader and community. We made our message clear and transparent based on scientific basis. So far, we public's acceptance and confidence toward a vaccine are pretty remarkable. Although Indonesian archipelago is quite challenging, we have escalated a massive vaccination movement. Tens of mass vaccination sites, thousands of hospital, primary healthcare, and dozens of private sector and civil societies are working together. Local health workers coming to the village to vaccinate people. NGOs are hiring local transportation to pick up the elderly and bring them to the mass vaccination site. It is heartwarming to see people are helping hand despite the pandemic. Indonesian vaccination pace one reach 500,000 jabs per day. Unfortunately, there is a slowdown among others. We are experiencing delay from manufacturing country due to the surge of COVID-19 cases. This regard, Indonesia strengthening our regulation through bilaterally, regularly, and multilaterally mechanisms to obtain the vaccine, and we also state on company and research institutions to accelerate the COVID-19 vaccine research and manufacturing preparation. In ASEAN, we are currently in negotiation with UNICEF through multilateral mechanism to provide vaccine for ASEAN member states using ASEAN COVID-19 response funds. Ladies and gentlemen, as a current chair of the Asian Health Minister meeting, Indonesia concerted to collective respond COVID-19 in the region, including promoting a new initiative build a more resilient ASEAN. In this regard, Indonesia initiated, among other, to strengthening the diagnosis pillar, testing, tracing, and genome sequencing, and health protocol pillar to support pandemic response for cross-border movement and economic recovery. In this regard, Indonesia is also exploring the possibility of developing the mutual recognition range on digitalization health certificate among the Asian member states, the supporting and easing coordinating of the travel control corridor agreement. Specially, video conference will be conducted in early May 2021, chaired by Minister of Health of Indonesia, to discuss the further commit and three main topics: vaccination profiles, genomic sequencing network, and to address mutation and health protocol development. Apart from the current vaccination rollout, we still have to enhance the research and development vaccine to understand vaccine efficacy and recently now mutation of SARS-CoV-2. In conclusion, no single government or multilateral agency can address these threats alone. Nations should work together in the close international cooperation and collaboration throughout bilaterally, regionally, and multilateral forum to address this pandemic. Most important thing is no one is safe until everyone is safe. Thank you so much.
Thank you, Dr. Dante. Despite many things that we know that we have to improve, but we need to give appreciation for Minister of Health work and also all of Indonesian work that we have challenged this national program on COVID-19 COVID vaccination. And it's not that easy to have a whole country with different and various type of people and to have this vaccination. But still, we believe that this vaccination is a light on the tunnel. And this is what we're waiting for. For maybe last year, we're still wondering when will the vaccine come, but the vaccine now is maybe the very hot topic. Maybe we can discuss this a whole day, but we now have Dr. Sunil Bal. Lucky for us, an honor to have the coordinator of COVAX immunization and vaccine development from World Health Organization, Southeast Asian Regional Office, with the topic of consideration for vaccination certificates in the context of COVID-19. Dr. Sunil Bal, take your time.
Thank you very much. Excellencies, distinguished participants, ladies and gentlemen, very good morning to all of you. If I may be allowed to share my screen, please, because it's saying you cannot start screen share while other participant is sharing. I will take the opportunity to present a few slides, but somehow I cannot share my screen. I keep getting message, you cannot start screen share while the other participant is sharing. Okay, I think I have the rights now to share my screen. Can you see my screen, please?
Yes.
Okay,
Yes,
thank you.
can see.
Okay, so I'll be very quickly going through the considerations for the vaccination certificates in the context of the COVID-19, and I'll give the WHO perspective on this. Now, I'll start by talking about the current temporary recommendations under the IHR. The 7th Emergency Committee of the IHR met on 15th April and made recommendations for the countries as well as provided some advice for WHO. Now, in the context of this, at the present time, WHO's position is that national authorities and conveyance operators should not introduce requirements of proof of vaccination for international travel as a condition for departure or entry. This is because at this point of time, there is not enough evidence, and there are many unknowns regarding the efficacy of the vaccines in reducing transmission, and also because there is limited availability of the vaccines. A preferential vaccination of travelers could actually lead to an inadequate availability of the vaccine for the priority populations that are considered at high risk of severe COVID-19 disease. Having said that, there is also advice to WHO to continue to update the WHO interim position on the requirements of proof of vaccination, look at the tools related to the standardization of paper and digital documentation of COVID-19 travel-related risk reduction measures. And it is in this context that WHO is looking at some of the technological considerations around the proof of vaccination and international travel. So should a requirement of proof of COVID-19 vaccination for international travelers be introduced in the future, then the recording of the proof of vaccination should be based on the 4 key design principles of equitability, accessibility, scalability, flexibility, and sustainability, as well as privacy protecting. Now, equitability implies that everyone should have the right to obtain and hold a digital health card or a vaccination certificate, and should not increase the health inequities or increase the digital divide. Accessibility, every vaccination certificate should be verifiable, should work online and offline across multiple platforms, should be paper and digital, to ensure that, everybody can access it. And there should be interoperability specifications based on open standards to ensure equitable access to a range of non-proprietary digital tools. The scalability implies that the technological specifications should be flexible and adaptable for each member state to meet the public health needs, as well as the needs of individuals, and it should meet the country's holistic public health preparedness and response plan, while also being usable in other countries. The privacy remains important. Individuals should have access to their own data, to be able to fully control whether they want to disclose the vaccination status to the others. Member states have received, reached out to WHO for assistance, guidance on specific products that they aim to deliver in digital format as a vaccination certificate. And several member states have produced and shared with WHO products that have different features, different data collections, different terms. WHO has put in place a working group which has several stakeholders, as you can see on the slide, and WHO is working on establishing technical specifications on the core data set to represent the data, ensure the privacy, security, and connect to the national tools to ensure the verification of certificate. Now, what is a smart vaccination certificate that WHO is looking at? It's a medical document that is managed by the public health authorities of the member states. It focuses on the vaccination records, needs in a country as a personal record to help ensure the continuity of care and complete vaccination, and also serve national travel needs. It is a health document to be issued by the recognized public health authorities of the member states. Now, because several countries rely on paper, the approach needs to function even if there is no internet. So a digital twin of the traditional paper record will have to be thought about. A paper with a QR code, as well as a digital approach, will be required to ensure that no one is left behind. Focus of the vaccination certificate, of course, is a of vaccination to reinforce the continuity of care, but it should be architected to evolve with the needs of countries. Should there be a need for information, further information, say on lab results or prior COVID infection, or if countries to leverage the present certificate as a starting point for national health record. The key thing is a global health trust framework to facilitate the verification and validation of the vaccination certificates. And there are three key pieces that I've shown in three boxes on this slide. The first one is on the left bottom, which is in green, the state A. It says at this point, the vaccination certificate specifications should describe what each member state minimum practices are, as well as the core data set that needs to be protected at the time of the vaccine administration. WHO is also looking at setting up a public key directory at the global level, which will host to establish technical infrastructure needed for the overall chain of trust. And then finally, at the verification point shown on the right lower panel on this slide, at the verification point, the authorized institution should be able to leverage the chain of trust to confirm the contents of the certificate and verify that it's not been tampered with, and also verify that it was actually issued by the member state purported in the vaccination certificate. What this approach facilitates is for member states to trust in the certificate of the other countries, reduce the potential for subjectivity, and prevents the ability of any fraudulent certificates from being issued, and increases the international interoperability of the delivery systems so that they function together in a consistent manner. At this point, I would also like to emphasize that the vaccination certificate is part of a larger digital innovation ecosystem for immunizations. Certificate is, it includes several other aspects: vaccine monitoring to ensure target populations have been fully reached and there are no dropouts; infodemic management to ensure that the vaccine hesitancy does not undermine the benefits of vaccination uptake; micro-planning to reach the vulnerable groups; counterfeit detection to protect against counterfeit vaccines which damage trust and demand; and vaccination status to ensure the health system and individuals have portable documentation of real-time authenticated information on the proof of vaccines. There are key areas of outputs from WHO. These include the specification and guidance documentation, the country support, and the global services. There are several aspects under these, the digital vaccination certificate, the national trust framework, the international trust framework, the white label applications, the community of practice, the technical support, especially to the lower middle income countries, the financing to implement this, the WHO public key directory at the global level, as I said, the pre-qualified applications and verifiers, the global vaccine product registry. With that in mind, the vaccination certificate and the SMART working group is expecting to be a personal, to make sure that this vaccination certificate is a personal health document, serving the holder as a personal record to support the continuity of care and proof of vaccination. In addition, it should also become a core foundation that will evolve with needs of the individual, of the immunization program, and of the health system as the science around the COVID-19 vaccine evolves and the member states implement different measures to ensure specific populations benefit from the vaccinations, and even when there are limited supplies. The vaccination records are essential program tools, as I said, for continuity of care. It could be there are several aspects of it, as well as as a proof of vaccination. There are some specific timelines, that WHO has in mind. The candidate one has already been released for this vaccination certificate on 19th of March, and this has been released for public comment. The second candidate, candidate two, is likely to be released sometime in May. for ethical and privacy considerations of a digital vaccination certificate. And then there will be a candidate 3 that is likely to be released in June with an iteration of the technical specifications for a national vaccination certificate and a national trust framework and a global trust framework. And it is expected that by July, there should be the first version that will be released to be with the intention to be a complete technical specification document. So that's pretty much that I would like to share, and thank you very much for your patient listening.
Thank you very much, Dr. Sunil. We realize now that the vaccine certificates, it's not meant to restrict the mobility, but it's actually to ensure the mobility is safe. That's a whole different point. And this is actually maybe the light in the tunnel. And then because of that, mobility should make a productive and collaborative effect to end this pandemic. Thank you, Dr. Sunil. Now we will have an interesting session because of all the keynote speakers already delivered their speech and then their perspective, and we learn a full of insightful perspective from them. And then we will welcome you if you want to have a Q&A question for the keynote speaker. Anyone? Okay, I will invite Prof. Dr. Ari Fahrialsyam, internist, gastroenterologist, Dean of Universitas Indonesia, Faculty of Medicine. You may take your time to give your perspective and also question for the keynote speakers.
Okay, thank you, Dr. Vito. Excellency Vice Minister of Health, Republic of Indonesia, Rector of University of Pajajaran, and Dr. Julia from ASEAN Secretariat, and also Dr. Sunil from CRO WHO. Yes, it is, I think, this is interesting guest lecture, key, and I mentioned about the travel certificate. I think a travel certificate is to enable anyone vaccinated against COVID-19 or who has tested negative or recently recovered from the virus to travel within ASEAN countries. So I think another issue raised has been that data on efficacy of vaccine in preventing a person from carrying or passing on the virus is incomplete. And we know now some countries in Europe will open its border to visitors who have received the vaccine without the need for testing or quarantine letter. And Dr. Sunil have explained about the vaccination certificate. And yes, so the question to all panels, what is your opinion on the possibility to implement ASEAN travel certificate based, of course, based on the high standard health protocol to enable new norm mobility in our ASEAN countries? I think we need to support the visions of ASEAN Connectivity 2025. This is my question to the panels, Dr. Vito, please. Thank you very much.
Thank you very much, Prof. Ari. And then I will invite all the panels to open the camera, and then maybe we can start from Dr. Sunil first.
Yeah, I mean, thank you very much for that question. I think it's an important question, and so as I said, you know, while WHO's position is that at this moment it should not be mandatory for the travelers to produce a vaccination certificate. However, you know, as has been advised as well, that WHO is looking at the future options of developing and helping and supporting countries with developing vaccination or health certificate that could facilitate the movement of the population. However, the considerations that I showed in my presentations must be factored in, you know, making sure that, you know, this does not, first of all, increase the inequity because the vaccine is available only in limited quantities at this moment. So any diversion of this vaccine from the high-risk populations to the travelers may not be a good strategy. So as long as that can be ensured, that is one. The second aspect that I would also like to highlight is that, any vaccine, I mean, we have growing evidence now that there may be some role that the vaccine is playing in reducing the transmission. However, no vaccine is 100% effective and efficacious. So there will be failures of the vaccine as well. And ensuring that because of this, just because there is a vaccination certificate does not lead to any reduction in other public health measures for COVID-19 vaccine, for COVID-19 vaccine disease, sorry. So that will be another consideration. And then the security, the privacy, the equity, the accessibility, and ensuring the flexibility and the scalability. I think those aspects, as long as those can be taken care of, and I mean, so that should help to come up with something. And WHO is willing to provide the technical support. As I said, we are already working on that to support the countries for on that aspect. Over from my side. Thank you.
Thank you very much, Dr. Sunil. And now for the next, Mr. Cecep Herawan, I think you may also give response as well to what Dr. Sunil has said, as well as Prof. Ari already asked. In
Thank
context
you.
of cross-country traveling, yes, please.
Thank you, Dr. Vito, and thank you, Prof, for raising this issue. I think we couldn't agree more that this pandemic is a learning process for us, almost in every sector. So as mentioned by Dr. Sunil, we're not sure about the efficacy, we're not sure about the effectiveness of the vaccine, and so many unanswered questions up to now. Back to the issue of travel certification, if the travel certificate as a tool, as you mentioned, Dr. Vito, for a safer traveler, perhaps you may consider it positively. But if travel certificate will be a mandatory for those who will be travel across the border, then it will create another issue, another challenges. First, what type of vaccine that we're talking about? We have a number of vaccine. We have Pfizer, Moderna, Sinovac, Sinopharm, and others. And please bear also in our mind that there are two types of vaccine. The number one is vaccine which is listed in the EUL of WHO, and another one is vaccines based on the use authorization from each and every country. Which vaccine that we're going to consider as a common platform for all? So this is another question. Secondly, of course, we're talking about the duration after the vaccination process, because we're not sure about the efficacy and also the effectiveness of each and every vaccine. Whether we need to renew it every 2 years, 1 year, or 6 months, we don't know. So this is the we need to answer this question before we are proceeding to agree on the possibility of using the vaccine certification as a mandatory document for traveler. So I think this is my initial response to the question. Thank you, Dr. Vito.
Thank you very much, Mr. Cecep. I think you're still a very optimistic person. Okay, Dr. Dante Saxono Harbono, the Vice Minister of Health. Yes, Mr. Cecep?
We need to be more optimistic in these days, Pak.
Yes, I believe so, and I believe all the participants as well. Dr. Dante Saxono Harbono, as the Vice Minister of Health, Republic of Indonesia.
Yes.
How do you respond? Yes.
We should look at the situation in the world, all around the world. So some cases in some nation, like in India now, the cases is rising very sharply. So it's difficult to make sure that people who from the specific country already have vaccinated is safe for traveling to other country. So most important is, and also the efficacy of vaccine is not covered as much as we expected. So it's not needed only the certificate of vaccination to people have in if they are going to transport from place to another place. So I think beside this traveling certification, we should need to examination some specific procedure like we already have, like swab procedure, like quarantine procedure and isolating procedure at the time they arrive in every country. So from another side that already Dr. Cecep mentioned, we still don't know what the efficacy vaccine will be covered of us after the vaccination time. It could be 3 months, 6 months, 1 hour. We don't know, not yet now until now. So the travel vaccination is maybe needed in the future when we already make the pandemic become release and become endemic, or the case will become so going down. But now the travel of vaccination is not enough to guarantee that people is already have a good status for traveling to other country. That my side.
Thank you very much, Dr. Dante. So safety first, safety first. That's the point of what you're saying about, and then I'm totally agree with that actually. And now we almost sure that with that many perspective, the big challenge have a big opportunity also for us. And then I would love to hear from Dr. Julia Puspadewi Tiaja as Director of ASEAN Integration Monitoring, ASEAN Secretariat. Please take your time.
Thank you so much, Dr. Vito. I think, both Pak Cecep and Dr. Dante has shared many of the key considerations regarding the proposal. In the context of ASEAN, we are discussing on the ASEAN travel corridor arrangements framework and its procedure. And of course, bottom line, the intention of this is to facilitate the safe resumption of people mobility within ASEAN, starting with the essential business travels. Different procedures are being discussed to see how this work can be facilitated. It is, of course, it's going to work in complement with the many of the bilateral and other multilateral travel corridor arrangements that's being discussed by our member states. With regard to vaccine certification, I think previous speakers highlighted some of the key points for consideration. The efficacy of the vaccination itself, the recognized vaccines within each country, the use of digital platform, the need to ensure interoperability of this platform. And of course, I think what's also key, it's on getting agreement on the kind of standards information that is required for such vaccine. And I'm really glad to have Dr. Sunil in his presentation earlier, laying out some of those considerations and the principles that we need to consider in developing such tool. But bottom line, what we see is that vaccine certificate is going to be a very useful tool to facilitate people mobility. But we need to take into consideration the different access that countries have to vaccine and the efficacy and all the other considerations that I mentioned earlier. So yeah, it's one of the I think useful tool to consider, but perhaps I think making that mandatory is something that has to be given a serious consideration given some of the points raised earlier. Thank you.
Thank you, Dr. Julia. And well, actually, there is so many questions in the chat box, but we have to choose because, and anyway, we will still have a whole day, so you can still ask after this. And maybe I will choose one of them. Maybe. This may be one of the question. How about if we're traveling in the maybe with the reason of maybe student exchange or research? Is there any privilege for that? Maybe Dr. Ronnie will talk more about that. Dr. Ronnie?
Yeah, thank you so much,
Dr. Ronnie from UNPAD.
Yes. Yeah, thank you so much for the opportunity. I think this is very important questions. We need to live with the pandemic. We need to make a strategy with that. Definitely, in the perspective of university, we do really expect some privilege for a student for moving for one to other places. But having the basis of the policy statement that we will hear for our speaker today, also the decision how we will deal with the situation, it will help the student to have a confidently move from one country to the other country. Definitely need to follow some specific criteria that we will agree together. And then this is not only talking whether they had vaccines or not, but the health certificate may be very compulsory and important to declare, and then to empowering, and also make the travel connection easier between country to countries, and then these academic and research can be done in the better ways in the day today present and even for the future. So maybe this is my response. We will hear more about the input from the guest speakers and others opinion from the expert. I think this is will empowering and enrich our knowledge, and we can decide the good basis as a holder for all the university in Asian and also for the minister itself. Thank you so much, Dr. Vito.
Thank you, Dr. Ronnie. Insightful perspective. And then after this, actually, we will have a report from Director of ITTP, Prof. Eko. But before that, let us appreciate all the keynote speakers today. So let us take a photograph. It's actually not just documentation, but it's actually an appreciation for all of you, our distinguished speaker, that you may have your time maybe with us. And also actually a proof that what already you taught us about in the future. So yeah, committee, you may take photograph.
Okay, to all participants, please open your camera because I will be taking pictures for documentation. For the first page, 1, 2, 3. For the second page, on the count of 3, 1, 2, 3. For the last page, 1, 2, 3. Okay, finish.
Okay, I thank you very much. I have several messages that our distinguished speaker have another duty. So yeah, thank you very much once again, and good luck for your job. Our appreciation for you all. Prof. Rina, Dr. Dante, Pak Cecep, you may have your time on your work. Thank you very much. Stay safe.
Thank you.
For
Thank
all
you.
of us. Yeah, okay, all participants, we're already now getting more insight, and then now we will learn more about what actually we have today and what the proper future. And then to know what our strategy best, actually we have to know maybe in statistic, maybe we have to know the reality other than just issues on the newspaper. So now we will have the presentation from Professor Eko, General Chairman ITTP COVID-19. Well, you know, it's a topic COVID-19 introduction and progress report so far. Prof. Eko, the time is yours, please.
Okay, thanks. Okay, Dr. Vito. Okay, I share my screen? Okay, okay, yes. All right. Can you already my screen? Can you see?
Yes, bro. Proceed.
Yes, yeah. In this moment, okay, I would like to thanks to the host, Prof. Rina, and the team, Dr. Roni, Dr. Hollis, and also Dr. Aulia, and also thanks to all the distinguished keynote speaker and also speaker that able to come for this meeting today, and also for all the participants that want to spend time, and not forget also all the committee that working already for last few weeks. Okay, thank you very much. So this ITTP COVID, or we call the International Teleconference on Technology and Policy, in the beginning we call for the COVID-19 risk management. Yeah. Actually, we hope this is like impactful program. And then second, we try just to utilize zero budget, so that really we require community contributions, and also quadruple helix, the collaboration between government, university, industry, and also community. And we hope that this is also part of the ASEAN integration, where we need to have one vision basically. So and then I will talk also about the virtual platform, website, mobile apps, and so on, that we have it already. And then very important also for me today also to inform, to call one more everyone here, or all the participants to submit paper, so that we can conduct, or we can hold our conference in August. And then we have some high quality publication that we will show to you. And then as today we have the first quick win activity, which is we try to draft, or to have the early study on the travel certificate. And then last not least, but we would like also to continue these activities become sustainable activities. As Prof Rina mentioned, that we may need to stay for 3 years until really the impact of the pandemic we can slowly reduce. So the identity COVID program, the topic for this year that will be conducted on the 6th to 8th August, basically the supporting implementation of COVID-19 recovery plan in Southeast Asia. I think Dr. Julia already presented today about the recovery framework. We try to see and that, I mean that point, and then we will support it. So this is basically the schedule on the program tentative for the conference that will conduct on the 6th August. 6th August on Friday. We will invite 3 keynote speakers from 3 countries. Hopefully can come. We are still working hard to have this. And then we will have 4 important speakers, which is talking about the Smart Mobile Certificate that is result from today meeting. And then we will have the second invited speech. They're talking about the digital economy tech incentive, and then tourism digital zoning, and also digital security and interoperability standard basically. So this is the first day in the conference. And then in the second day, still in the first day, because this is just half day, and then in the afternoon, we'll have the final discussion on the ASEAN Smart Mobile Certificate. It means this material on the result of today, we will continue to be studied, so that and that month on the 6th August we can have the final discussion on that. Yeah, hopefully, and that time's already agreed by some countries. So and then also final discussion for ASEAN digital economy, for ASEAN tourism, and also the security standard. This is some program that we have on the first day. And then in the 7th August and also 8th August in the morning, we have parallel sessions. We hope that we can have like 300 papers presented at that time. It means we will have like 9 parallel sessions from 3 tracks, the health science tracks, the social science track, and then the natural science or engineering tracks. And then half day and the end of the Sunday, we have the award ceremony and culture activities, because and that day is the birthday of ASEAN. So we, instead using the organization structure, we prefer to use the formalized network structure. Basically this is the digital new form of the organization in the digital era, where we will communicate each other. The communication basically, everyone can access directly to the central or to the cloud, to the committee. And then we have the organizing committee, consists of postgraduate students, young lecturers, and anyone that interested to work with the organization of the event. Currently we have around 42 members from PM, from UBD, from University Indonesia, University Pajajaran, and University Airlangga, basically. More members are invited, basically. And then we have also For example, for today, we have the local host. The Pajajaran University become the local host. But the next, okay, we would like also to invite other universities to become the local host. And also we have the network executive, which is, okay, consists of, okay, anyone that interested to collaborate and also to communicate with all, okay, the stakeholder here. And then we have the, okay, steering committee that currently is the, okay, leader of university. We have the 27 members university. And also, okay, we have the scientific committee that currently we have around, I think, more than 125 because, okay, more and more, but we invite more and more our scientific committee to join with us. And advisory committee is from the leader, the government leader, basically. So this is basically how our network structure working. Yeah, okay, we hope that more and more people can join, okay, this, yeah, without limitations. And then as virtual platform, we have the website. Okay, please visit our website. We have some mobile apps. Okay, you can download. You can get also some news, daily news from our mobile apps. You just search ITTP at Play Store, and then you can download it. We have limited, okay, place also for the discussion. Any question you can ask, okay, through this, okay, mobile apps. This is also can be used already. Only, as I mentioned, limited. Will be no picture and also no video. And then we have also some social media like Twitter, Facebook, LinkedIn, and then, yeah, Instagrams, and so on. And then anything you can also use still WhatsApp. Yeah, we have also some WhatsApp group, okay, to manage, okay, this platform. So now, as, okay, we already we know already opening the extended abstract submission. Please, yeah, every scientific committee we encourage to submit. Hopefully, can 3 papers, and then the network executive will soon communicate with all, okay, to open the list of the paper, because we just left, okay, a few months, 3 months, a little bit more, okay, to have, okay, all the papers, because we need to have the target paper for 300. It means every chapter or every track we hope that 100 in average. So, and then, okay, in this conference, especially the registration fee, we make a free for the committee. Okay, that's why we need to have the committee to submit up to 3 papers, so that if every committee can submit 3 papers, then we can have, yeah, around 375 papers already. Okay, this is that, okay, we hope. But we still encourage, okay, other people not from the committee also, okay, submit the papers. And publication, this is some identify and also already, okay, discuss with them. Okay, our papers or proceeding will be published in ITTP COVID-19 proceeding. We try, okay, okay, to publish in the MDPI proceeding. And then, okay, we have also IEEE Explore. We have also Journal of Soft Computing. We have the Multi Journal of Fundamental and Applied Science. We have CASMAS. Okay, we approach already Surgeon Journal in Singapore, and okay, so on. Okay, we encourage also the scientific committee. Please, okay, welcome to, yeah, suggest for any journal name so that we can approach, okay, become one of our publication place. And then, okay, for the pre-conference activities, we have, okay, some webinar. Yeah, for the first, okay, thanks for Pajajaran University that agreed to become this host. And then the next, the Yangon University of Economics, yeah, okay, will also soon, okay, manage this. Hopefully, in this very difficult situation, okay, we can still able to do the webinar too. And then thanks also for University of Malaya, Prof. Yong, okay, to, yeah, agree to host the seminar in mindfulness. And then, okay, University of Brunei Darussalam, thank also, yeah, okay, Dr. Sherin, and also here, Prof. Ayub, Dr. Masita, okay, to have to host the seminar for tourism, related to tourism, basically tourism digital zoning on July. This is the 4 activities that, okay, we will conduct, okay, before the main conference. And then for the post-conference, this is, okay, first, we will continue to formalize, okay, the network structure. Yeah, we may propose to become the, yeah, just the ASEAN network on the technology and policy for the COVID-19 risk management. Okay, later we call INTP instead of ITTP. And then, okay, we try to, okay, support the implementation of COVID-19 post-recovery plan. And then, okay, there are 3 webinars that already discussed and also a few university, like the COVID-19 holistic treatment ASEAN Digital Security and Interoperability, and ASEAN Affordable and Acceptable Multi-Modalities COVID-19 Screening. And then we have also second and third ITP COVID-19 into next year and after next year.
Yes, Prof. Eko, you are still with us?
Disconnect.
Yes, Prof. Eko, are you still with us? I think something happened, but I'm really excited to see all of the plan of webinars. I think we will learn a lot of from that perspectives. See there's a people minding of Asian countries. There is, so I think maybe we should go after all the webinars and then get our insightful to have a mass strategy for that, because our plan is actually a pivotal point to go further, because without plan, so maybe we should give Prof. Eko another time after this. Prof. Eko, are you still with us already? Join us again? Not yet? Okay, it's okay. Thank you very much, Prof. Eko, for all your report. And we are now, I sincerely give my appreciation for ITTP COVID-19 for this effort. And then after this, actually, very, very excited webinars, because most of all, then Dr. Eddie with vaccination efficacy, and then also there is insight from other countries. That is very interesting, because we have to know what happened in other country, what the challenge, and we learn a lot of that. After this, maybe I invite Mr. Hollis, PhD, as our moderator.
Okay, thank you, Dr. Vito.
You're already here? Okay.
Okay.
Mr. Hollis, I hand over this. Thank you very much for all keynote speakers, all participants. I will now sit down and see and learn much from our expert. Please take your time. I'm Dr. Vito Damai. See you next time. Pak Hollis, I give it an over to you.
Thank you very much, Dr. Vito. Excellencies, distinguished participants, ladies and gentlemen. A very good morning. Thank you for joining us in this warm morning seminar. My name is Hollis Abdul Khalik from Universitas Pajajaran, and I will moderate this today's session. COVID pandemic will not end soon, and it can be years more, or maybe become endemic. However, cross-border mobility is required to increase the economy, social education, and also cultural activities. A policy brief for ASEAN Smart Mobile Certificate has been drafted to support this issue. Although this Smart Mobile Certificate is some part of, it's also related to vaccine, but actually this is not a vaccine certificate. It is developed to enable cross-border mobility with implementation of secure, compatible, and high-level health protocol. And for today session, in this session, we would like to discuss more about this health certificate for cross-border mobility. And I would like to welcome our honorable speakers for this session. Dr. Eddie Fadliana from Faculty of Medicine, Universitas Pajajaran, Ms. Yong Yi Chin from Ministry of Tourism, Arts and Culture, Malaysia, Professor Tirawat Tananonyo from National University of Singapore, and Dr. Aulia Swantika from Faculty of Pharmacy, Universitas Pajajaran. In this session, we will hear the experience about COVID vaccine clinical trial in Indonesia and the impact of travel and tourism industries, health requirement for international traveling, and also health protocol for international traveling. I would like to invite Dr. Edi Fadliana to give us his experience in COVID-19 clinical trial in Indonesia. And before that, I would like to read a brief profile of Dr. Edi Fadliana. Dr. Edi Fadliana is field manager of COVID-19 vaccine clinical trial research team, Universitas Pajajaran. He is a medical doctor in Hasan Sadikin Hospital, and he is also a staff member of pediatric department in Universitas Pajajaran. So for Dr. Edi Fadliana, time is yours.
Okay, thank you very much, Dr. Halis Abdul Holik, as a moderator. First of all, I would like to thanks to the committee, to inviting me in this special session. And good morning, ladies and gentlemen. I'm great to see all. I would like to present my presentation. The title is COVID-19 Vaccine Effectiveness. Yes, please slide. Yes, the slide, please. Yeah, the content after first introduction, and then about the method, the trial, about UNPAD and Sinovac trial, and then the third, comparison of various COVID-19 vaccine platform, and the fourth, about difference between vaccinated and non-vaccinated individual in terms of immunity level. And then we know, yes, please, slide. This is the epidemiological trial. We know that in this model, the disease a result from the interaction between the agent and the susceptible host in an environment that support transmission of the agent from the source to that host. And then this concept can be applied also to current COVID-19 pandemic event. Yes, slide, please slide. If we look the situation in the world, we know the first human COVID-19 were identified in Wuhan, China in December 2019. On March 11, 2020, the WHO declared the outbreak as a pandemic. And last update in the world, more than 140 million cases with more than 3 million deaths in the world. And the condition in Indonesia illustrated in this picture. On the data on 14 April 2021, that is more than 1.5 million the confirmed cases COVID-19, and then more than 42 the death reported, and then more than 1.4 million recovered cases reported. This is until now the situation is still the problem. And then, yes, slide please. If you look the structure of the coronavirus, this structure, for example, this is the whole cell or spike protein, nucleotide protein, and membrane protein. This is content of the virus. Is the basic to making a vaccine. For example, whole cell the vaccine to make the inactivated vaccine, and then they are also from mRNA or spike protein and so on. Yes, please slide. If you look now, the many kind of the vaccine, but until now, only some vaccine who until the phase 3 clinical trial. For example, for platform inactivated, they are Sinovac and Sinopharm. And from platform mRNA, the BioNTech, Pfizer, and Moderna. And then the viral vector from University of Oxford or AstraZeneca, and then Gamaleya and Johnson and Johnson, and CanSino also, and then protein subunit from Novavax. Yeah. This platform, I think this is important, but the same goal in all the platform, which is to produce the antibody. And then if you look the inactivated vaccine, for example, from the Sinovac, this is a simple procedure. The virus are grown in the mammalia culture and then inactivated with chemical or other formaldehyde, and then absorbed into the aluminum hydroxide, and then the bulk vaccine, then formulated with phosphate buffer saline and sodium chloride. And then we collaborate, yes, slide please. On August 2019, we collaborate with sponsor. This is Biopharma, the collaboration between Universitas Pajajaran and the sponsor. The sponsor is Sinovac, Biopharma, and Kementerian Kesehatan Republik Indonesia. We collaborate to make a phase 3 observed blind randomized placebo control study of the efficacy, safety, immunogenicity of SARS-CoV-2 inactivated vaccine in healthy adult age 18 until 59 years in Indonesia. Yes, slide. This is the method, the trial. First, the subject, there are 1,620 subjects who divided into two groups. The first group vaccine received 3 microgram the vaccine, and then the second, the placebo without the vaccine. And then the vaccine we give twice with the dose 3 microgram per dose, and then between first and second dose about 14 days. And then we also make a blood sample from before give the immunization, and then 14 days after immunization, 3 months after immunization, and 6 months after immunization. And then we know the efficacy until 3 months after the second immunization. Yes, slide. This is the first visit, the first study on August 11, 2020 in our city, Bandung City. There are 6 sites for the clinical trial, and then first visit and first immunization in this trial also visit from our President, Dr. Joko Widodo, on August 11. Yes, slide. And this is the result. The result after immunization. This is the adverse event. The adverse event consists of the local reaction and systemic reaction. We look in this table. This is a safety from the preliminary report, which consisted the data from about 500 subjects in subject immunogenicity group at 14 days. This is period after the first vaccination. The incidence of the local reaction about 39% in vaccine group and 27% in placebo. The local reaction, for example, this is about the, for example, there are UDEM or other, for example, induration and so on, yeah. And then systemic, for example, are there about the fever and then myalgia and so on. And then the systemic reaction incident rate about 45% in the vaccine group, and then 39% in the placebo group. But the most common local reaction was pain, while the most common systemic event was myalgia, and no significant difference between vaccine and placebo. This is very, very low incident for local reaction or systemic reaction. So, and then no difference significant between vaccine and the placebo group. Yes, please slide. And then how about the adverse event after second dose? At 20 days follow-up period after the second vaccination, the incident also lower. Maybe this is 34% in vaccine group and 33% in placebo group. And about the systemic reaction was 37 in the vaccine group and 34 in placebo group. And in vaccine group, fever was reported only in 2.5% participants after the first dose and only 1.8% participant after second dose of vaccine, and then no significant difference in proportion between vaccine and placebo group. If we look the difference after the first and the second dose, we looked at the after the second dose, the incidence of the local or systemic lower than the first dose. And the majority of the adverse reaction have mild intensity. Yes, slide please. And then how about the immunoglobulin or antibody? The at 28th in the vaccine group, this is the immune response for seropositive rate of SARS-CoV-2 antibody, immunoglobulin G, later using the ELISA at 14 days and 3 months after second injection were 99% and 99% respectively. So it is very, very high. And the seropositive rate of SARS-CoV-2 neutralizing antibody using neutralizing assay in the vaccine group at 14 days and 3 months after second injection were 95% and 83%. So this is, they are trend to be lower after 14 and 3 days after the second immunization for the neutralization antibody. Yes, slide. And this is also the antibody in the vaccine group. The seroconversion rate of immunoglobulin G antibody at 14 days after second injection were 97%. And then seroconversion rate 14 days after second injection were 87%. So this is a little different. Yes, slide. And how about the efficacy? This is efficacy after 3 months after second dose, 3 months after second dose. So in this study, the efficacy evaluation 2 dose of SARS-CoV-2 vaccine in preventing COVID-19 will be conducted until 6 months. In this table, presented efficacy analysis based on the primary endpoint for all subjects with a data cutoff of January 9 at 2021. So about 3 months, yeah. Based on the primary efficacy endpoint, we found that efficacy in preventing symptomatic laboratory confirmed cases of COVID-19 occurring at least 14 days after the second dose of vaccine, about 65.3%, with 7 COVID cases occurred in the vaccine group, and then the 18 COVID-19 cases in the placebo group. Yes, slide. And then after emergency use of the immunization on January, yeah, on January 11, 2021, Indonesian National Food and Drug Agency, or Badan POM, released the emergency use of authorization to vaccine Sinovac. And then the next day, on January 12, 2021, halal certificate from Majelis Ulama Indonesia to PT Bio Farma. And then after that, on 13 January, it is maybe start to mass SARS-CoV-2 vaccine program. And then the first who received the vaccination is our President, Joko Widodo. And then how about the vaccine situation in the world and Indonesia? At least now in the world, more than 185 countries and territories have administered more than 928 million doses of COVID-19 vaccine. And the vaccine rollout strategy varies from country to country. Some have favored vaccinating as many people as possible as quickly, while others have tried to prioritize vaccinating specific vulnerable group. In Indonesia, has started the vaccination by prioritizing the vulnerable group, for example, healthcare worker, and then after that, the public services, and continued with the elderly. From the target 40 million in the phase in the stage 1 and stage 2, and then the 27% who received the first vaccination, and then 19% who received the second vaccination. So maybe this is the coverage maybe still low until now. And then don't forget, after we receive the immunization, that are many factors that influence the immune response. Yes, please slide. Yes. Yeah, this is after we receive immunization. Don't forget that the factor that influence the immune response of vaccination. For example, the intrinsic factor, extrinsic factor, and then a perinatal host factor, and then also behavior factor. For example, smoking, alcohol consumption, exercise, acute psychological stress, or chronic psychological stress, and sleep. Also, other factor For example, the nutritional factor, and then environmental factor, and then vaccine factor, and administration factor. So, this slide. Don't forget, after we receive completely immunization, don't forget to maintain the health protocol, to always use the masker, and then washing the hand and social distancing. And then, this slide, my conclusion that COVID-19 vaccine in our trial, the vaccine from Sinovac is safe to administer and has good immune response to 18 and more than 70 years. And the efficacy value has exceeded the limit set by the WHO. The WHO limited is about 50%, but in the study, 65.3%. And since August 13, 2021, the COVID-19 vaccination has been rolled out as the national program. But after that, we don't know how long the protective level can be maintained. So I think it is more trial to know the antibody until, for example, 1 year after complete immunization, and then maybe we can now also to the booster. Maybe after 1 year or 2 years, are they needed to receive booster to all the participants. That's all my presentation. Thank you for the presentation.
Okay, thank you, Dr. Edi, for
yes, thank you.
A very interesting presentation. You saw useful information about the vaccine development and vaccine clinical trials in Indonesia. And actually, these trials is a collaboration, international collaboration, between UNPAD and Sinovac and Biopharma. I believe that many of you have questions, so you can ask your question in next session. Now I would like to invite our second speaker, Ms. Yong E. Chin. She is a Deputy Undersecretary of Tourism Policy and International Affairs, Division, Ministry of Tourism, Arts and Culture, Malaysia, MOTEC, Malaysia. She will talk about COVID-19 impact to travel and tourism industries. Before Ms. Yong present her presentation, I would like to read her profile. Ms. Yong E. Chin is Master of Social Sciences in Strategy and Diplomacy, and her experience related to this topic is she participated in formulating tourism policies and devised development strategies for the national tourism industry. So for Ms. Yong, time is yours.
Thank you, Dr. Hollis, the moderator. Can you hear me? I hope you all can hear. Thank you, Dr. Hollis, the moderator. Fellow panelists, ladies and gentlemen, a very good morning to everyone. First and foremost, I would like to take this opportunity to congratulate the ITTP COVID-19 for organizing this program, and also thank you for inviting the Ministry of Tourism, Arts and Culture Malaysia to speak in this important webinar. Over the last decade, tourism has actually experienced a continued growth and deepening diversification to become one of the fastest growing economic sectors in the world. It brings hope, prosperity, and understanding to so many lives and livelihood all over the world. But once this COVID-19 pandemic hit almost every country in the world, as a people-oriented industry, tourism is one of the hardest hit economic sectors, and it is expected to be the last to recover. As mentioned by the keynote speakers just now, you can see that how bad that tourism industry has been affected due to this crisis. Next, please. Can I have the slide next, please? Thank you. Before this pandemic hit the world, international tourist arrivals have been in the increasing mode, where in 2019, it increased by 4% to reach 1.5 billion globally. All regions enjoy an increase in international arrivals, including Asia and the Pacific, where it was the second most visited region in the world after Europe, and we had seen the fastest growth in recent years. Between 2010 and 2019, arrivals to Asia and the Pacific destinations has increased an average of 6% per year, compared to the world average of 5%, which outperforming all world regions. Next, please. However, in 2020, when the pandemic COVID-19 hit, Asia and the Pacific is the first region actually to suffer the impact of this pandemic, and the one with the highest level of travel restrictions currently in place. It recorded the largest decrease in arrivals, where this region saw 300 million fewer arrivals than in 2019. Furthermore, data from IATA showed the largest decline in international air traffic for the 5th consecutive month for Asia and the Pacific, which is about like 95%. Next, please. In the case of Malaysia, the tourism and hospitality industry actually play an important role in contributing to the country's economic growth and employment opportunities. In 2019, tourism has contributed 15.9% to the gross domestic product, or GDP, which accounted for about USD 58 billion. From the perspective of services sector, tourism industry contributed 27.9% to the entire sector, while for employment, the industry recorded 3.6 million persons, which constitutes about 23.6% of the total employment. This means that in Malaysia, 1 out of 4 jobs is provided by the tourism industry, as compared to the world, which is 1 over 10 jobs. Next, please. However, the severe outbreak of the pandemic and the implementation of Movement Control Order, or MCO, in an effort to stem the increasing number of COVID-19 cases in Malaysia have negatively impacted the country's tourism industry. It has affected many businesses such as accommodation, transportation, shopping, food and beverage, arts and culture, as well as business events. The ministry has actually estimated the loss on the tourist expenditure for year 2020 is more than USD 24 billion, with tourist arrivals declined 83.4% and tourism receipts declined at 85.3% compared to the year before. While domestic visitors and expenditure declined between 46% to 50%. Next, please. In order to enable the country's economy to recover and ensure the survivability and sustainability of the industry players, the ministry, in close consultation with industry associations, has formulated and implemented the Tourism Recovery Plan, which is the short-term action plan under our National Tourism Policy, where I will elaborate later, among others through the following strategies. You give me a minute, I think my battery is running low. Okay, through the following strategies. Revitalize domestic tourism. Since borders will remain closed, more emphasis is being put on domestic tourism to help offset the downturn in the economy due to the absence of foreign contributions at the moment. Therefore, industry players may tap on this market segment by offering personalized and creative packages and promotes the hidden gems in your countryside, as travelers nowadays prefer safe destinations with a laid-back lifestyle, fewer people, and plenty of fresh air. Next will be the embrace the technology of secure, seamless, and contactless travel, such as cashless payment, online booking, contactless transaction, and contactless check-in. Consumers nowadays prefer online booking and contactless transaction. Therefore, digitalization in all possible touch points is a must to fulfill customer expectation and satisfaction. To ensure the survivability of the industry, the ministry has actually implemented several initiatives to help ease the burden of the industry players, including simplifying the regulations, waiving of license fees for travel agencies and tourist guides, 40% discount on payment of compound issued and extension of compound payment period. The impact of the border closures following the pandemic COVID-19 has actually indirectly spurred the restoration of the environment, with reports stating reduced levels of water quality pollutions and improved air quality. This is the best time for us to re-strategize efforts to conserve and preserve the environment. For example, like considering carrying capacity on islands or fragile destinations, or can sit with the product operators to see in what ways can we encourage tourists to take care of our environment while he enjoys it. Next, please. This is the most important one, that is to restore public confidence to travel again. How do we do it? That's it, by adapting to the new norms and also implementing adequate health and safety protocols at all points of the travel journey, while ensuring the safety and security of travelers, workers, and host communities. And we're also looking at strengthening the public-private partnership, especially in recreating tourism, arts, and cultural products to be more appealing and innovative, as well as keeping the numbers of COVID-19 infection low. It is a joint responsibility between the government and the private sector to ensure the cases of COVID-19 do not increase by adhering to the SOPs such as social distancing, wear the mask, and sanitize our hand. And lastly, reskill and upskill to improve the quality and credibility of the profession. The ministry is actually working closely with the tourism training centers and private sector, such as Google and Shopee, in retraining and enhancing the tourism workforce skills during this downtime period. Next, please. For a long-term strategy, the ministry has designed and developed the National Tourism Policy 2020-2030 to strengthen our competitiveness, encourage sustainable and inclusive development, effective recovery based on the new norms, and to be ready and resilient for the future shock that will be supported by these 6 transformation strategies that you can see on the screen. These are like strengthening governance capacity, that is to strengthen the coordination and governance capacity of government agencies and local authorities directly or indirectly involved in tourism development to improve the delivery of competitive tourism products and memorable tourist experiences. Creating the special tourism investment zone that aims to boost the development in Malaysia's tourism sector by encouraging more private investment and public-private partnerships. Embracing the whole spectrum of digitalization that will provide the necessary tools for the tourism industry to be internationally connected, perform data analytics of tourism futures, and shorten the supply chain. Technological advancement has led consumers to utilize mobile devices and online platforms to access information, arrange, book, and plan an entire holiday. With this in mind, industry stakeholders should venture even more actively into sharing the economy, digital platform, social media integration, as well as big data analytics to customize tourism experience offerings to specific demographics across the globe. Enhancing demand sophistication is by increasing the tourist experiences that are unique, differentiated, and memorable. Nowadays, tourist demand is becoming more specialized, customized, and corresponds with the willingness to pay for a distinctive experience. Nowadays, they will be traveling in smaller groups, so it is important to increase the value of services and goods provided to tourists. Strengthening the commitment to sustainable and responsible tourism towards the Sustainable Development Goals, or SDGs. This will further strengthen the role of tourism as a catalyst for economic development in a sustainable, responsible, and inclusive manner, including minimize negative impacts on the biophysical environment, preserve cultural and heritage resources and values, and ensure the empowerment of local and indigenous communities. So no one is going to be left behind here. And the last strategy is upskilling the human capital to ensure the delivery of quality services in the tourism sector. The application of a service culture that cares about customers at every level in the tourism industry is actually important to keep tourists to stay longer and spend more, as well as increase the repeat tourists. These strategies also focuses on the provision of training in tourism and hospitality to enhance the competency of the workforce. Next, please. The vaccination has actually opened up a critical window of opportunity to fight the COVID-19 pandemic and promote the safe reassuming of international travel along other risk mitigation tools such as COVID-19 testing. In moving forward, the recovery of the travel and tourism sector will vary across country destination, where it will mostly be influenced by source market composition and opportunity for attracting more travelers due to changing preferences. Recovery potential is greater for destinations that rely more heavily on domestic travelers and those from markets within the same sub-region. Thus, the key components impacting the specific pace of recovery by destination is the typical composition of source markets and the potential for a destination to benefit from their residents switching to domestic travel from international trips. The crisis has also highlighted shortcomings in the availability of timely, comparable, granular data in quickly evolving situations. Reliable and consistent indicators are needed to evaluate the effectiveness of programs and initiatives and monitor progress on tourism recovery and resilience. Risk-based solutions to safely lift travel restrictions and get the international tourism ecosystem back up and running must be based on sound scientific evidence. This solution also need to be feasible to implement with sufficient capacity available to ensure this system can function reliably. Striking a balance between support and competitiveness, in particular for highly impacted sectors such as aviation, government intervention can slow business dynamics and productivity growth if not well designed. As in any other industry, government should avoid supporting non-viable companies. Rather, they should allow exit and promote resource relocation. Besides that, in the process of restructuring, governments also need to smoothen the transition for displaced workers. At the same time, also need to focus on supporting the industry workforce at risk of becoming unemployed. For example, job retention schemes to contain the employment and social fallout of the COVID-19 crisis. Finally, is the addressing sustainability along the entire tourism value chain. This is by accelerating more resource efficient, low carbon development, in particular by coordinating all stakeholders and ensuring the consistency and complementarity of public and private investment. A shift towards sustainable consumption and production in tourism offers vast opportunities. However, it requires work across the whole value chain involving all stakeholders and a commitment to using a life cycle-based approach to making product and services more sustainable. Thus, this was the wraps up for my presentation this morning. Thank you. Next.
Okay.
Thank you. Yeah.
Thank you, Ms. Yong, for such a nice and clear presentation. You share about comprehensive plan and action by Malaysian government. We know that tourism and travel industries are most severe. They got a severe impact about this COVID. Before we go for Q&A, we still have two speakers. We now go to the third speakers, Professor Tiro Tananonyot. He will share about regional study on vaccination certificate. Professors, before that, yeah.
Hello.
Hello.
Hi.
Hi. Thank you for sharing this session, Professor Riot. Before you present your presentation, I will introduce Professor Terawat Tananonyot. Is Secretary General of Foundation and senior researcher at HITEP, and also he is a professor at Singapore National University of Singapore. Professor Yot obtained his Doctor of Philosophy in Health Economics from University of East Anglia, England, and yeah, he's the leading the working groups of COVID-19 vaccination policy research and decision support initiative in Asia. Okay, to Professor Yot, time is yours.
Okay, thank you very much for the organizers in inviting me to talk here. I hope you now can see my presentation file. So I will spend around 10 minutes to introduce about our study. It's a regional study on the vaccine certificate. So I would like to also recognize my colleagues from National University of Singapore and from the Ministry of Public Health in Thailand. So I'm presenting on behalf of the Coalition team. So I'm going to give you first the introduction of the Coalition, who we are and what we are doing. And then I'm going to focus on the framework for assessing the cost and benefit of the COVID vaccine certificate, which is one of the major approach that we are using for this study to inform policy development related to vaccine passport and vaccine certificate. And then I give you an idea about the results of targeted survey to understand stakeholder positions and preference regarding on vaccine certificate. And I come up with some key messages. So this is the diagram showing the objective and structures of Coalition. So the project aims to produce guiding principles that can be used to inform the development and implementations of vaccine certificate, vaccine passport at the national and also the regional level. The regional level is focused in Asia. So, and the second one is to create a platform and template to share cross-country information related to COVID vaccine certificate and vaccine policy for public and private use. So that is the two main deliverables of the project. It's a 18-month project funded by the National Research Council of Thailand, and we have the HITEP from the Ministry of Public Health in Thailand and South Suhok School of Public Health at the University of Singapore to be the secretariat. And then we have two partners. One is we call advisory groups, which consisted of renowned group of experts in multidisciplinary fields. So we have WHO representative, we have former Director General of World Trade Organization, former General Secretaries of UNTAS. We have former Permanent Secretary of Minister of Foreign Affairs. We have Minister of Health in many countries. We have Director General of China CDC, etc. in these advisory groups. And we also have the working group who are our co-investigator in 10 countries from Laos to Thailand. I show you the next slide. And then we plan to work closely with end user, which is many national and regional policymakers and stakeholders. So these are the members of the working groups. So we have many good researchers from South Korea, China, Japan, Malaysia, the Philippines, Laos, Singapore, India, and we have the Dr. Uliyas Suwantika, who are also in these meetings representing Indonesia. So this is the approach that we are using. So we are trying to review the document related to international standard guidelines and even experience of using vaccine certificate and related instrument around the world. And then we also do in countries focus group and then targeted survey to understand the prevalence of stakeholders' concerns and challenge facing by relevant authorities. And then we also want to inform guiding principle by evidence. So we developed a framework and a studies program to evaluate the cost and benefit of vaccine certificate. This is to inform guiding principle of the implementations of vaccine certificates in each countries, in the participating countries and for our regions. And we will get all information from this study to put on the online platform in order to share, because we believe that the work for these 10 countries can benefit beyond these regions. And this is the framework that we are using to evaluate the benefit and cost of vaccine certificate, because I think we always we are talking a lot about the vaccine certificate, but it is a theory of change that we believe that when once countries develop policy related to vaccine certificate, the immediate implication is that it will determine the new quarantine and test requirement for travel across border. It can be reduced or even can remove those quarantine time, days, and the need for test before travel and when arrival. And that will impact to the willingness to travel of people between two countries if we have bilateral agreement, and it can be even impact in a border if we have a regional agreement, and that will impact to the increase of inbound and outbound travelers. For the obvious benefit that we heard even from our speaker from Malaysia, and I believe that we can also discuss a lot more, that there will for sure they will make an economic gain, because there are productivity gain at the country and at the regional level. There will be spillover effect of spendings related to travel, etc. But as a public health specialist, we also need to consider about the potential health impact, that it can be the case that it can increase local COVID-19 infection if the newly divided quarantine time and test making a missed case at the borders, and then it can affect to the increase. If the increased local transmissions, then they can increase cost of surveillance and treatment, and even it can impact to the productivity loss due to COVID morbidity and mortalities. And if there are serious local transmission, that they can bring back to the state and or national lockdown, and that for sure will impact to the willingness to travel again. And we also believe that the determinant of the quarantine time and test requirement should also be informed by the baseline local transmissions, the vaccine efficacy that used in those particular countries, both inbound and outbound, and the vaccine coverage. So we are in this project, we're trying to evaluate a benefit in the blue box against the cost in the red box, and by using the quarantine times and COVID test as a leverage. So we can have many scenarios with different quarantine times, with different test requirement in association with the baseline infections, vaccine efficacy and coverage in two countries. And then we will see which quarantine time and which test protocol can lead to the best outcome in terms of balancing between productivity gain and minimize the cost for health sectors. At the moment, we are doing pilot studies between Thai and Singapore, between the NUS team and the Thai MOPH team. So with the hope that after that, we will be able to produce the similar result between countries in these 10 participating countries. So this means that we may have 90 iterations for 90 quarantine time and testing protocol for 10 countries to consider. And we will, together with the information from the countries survey and focus group, we will bring together with the result and develop together the guiding protocols for vaccine certificate for national and the regions. So if you want to get detailed information about the framework, we just publish it on the US think tank Center for Global Development. They will provide a descriptive explanation of that framework too. So I move next on the in country input. We did an online survey, targeted online survey to get information from relevant authorities. So we target relevant authority, both public and private sector in Thailand, asking them a few questions. So I give you an idea. We ask them about preferable choice regarding on the instrument that should be used in Thailand. We ask them the vaccine certificate, immunity certificate when we include even people who already been infected but without getting the vaccine, so they have a natural immunities, whether we should provide them the certificate too. And then the vaccine passport, which is more formal and can be used alone rather than a certificate that is only the information and document that should be used with in conjunction with others, and the immunity passport. And so we found that the majority thinks the most suitable instrument for Thailand, it should be the vaccine certificate. And they reject that idea to provide similar certificate for infected population without vaccinations. And then when we asking them to rank the challenges facing when implementing the vaccine certificate or vaccine passport in Thailand. So you can see that the highest concern is about the fake potential, the fake document fraud, especially if we introduce the paper-based document. And they also concerned about the need for bilateral and multilateral agreement to develop mutual understanding and policy between countries and even within the region. So they believe that it's only the domestic policy is not enough to make this policy work. Also, they are concerned about the insufficient scientific evidence regarding on COVID vaccine efficacy, as discussed previously by our Indonesian speakers, and on the duration of protection of the vaccine that we are unknown yet. And then the efficacy in terms of prevention of infections and transmission of the vaccine currently used in each countries. The second length is they are also worried about the emergence of the new variants in many countries in our region at the moment. And then the third one is about the ethical concern and the discrimination about, because I think many countries in our region are facing the same challenges in terms of vaccine availability. So there are equitable vaccine accessibility and distribution across regions and also within the countries. And that would make the vaccines certificate implementations widen the inequity gap in our own countries. And then the last one is about the requirement of the resource infrastructures to make effective policy implementations. So the last one, I think, is very interesting that we asked the Thai stakeholder, when you think it's the right time to introduce these vaccines certificate in relation to the vaccine coverage in Thailand. We found that the majority of the Thai stakeholders consider that we should have enough population vaccinated before we fully implement this policy. So they regard that at least 40 to 60% and above should be the right time for us to introduce this vaccine certificate. So compared to the current policy, vaccination policy in Thailand, this means that the vaccine certificate should be implemented toward the end of this year rather than the mid of the year. So this is my last slide. The studies, the policy study is still ongoing. We just in the first part of the study, but we found that there is need for evidence to support policy development in order to balance cost and benefits of COVID vaccine certificates. So when we discuss this one to the public, I really like to see that we are giving the public aware, see both optimistic side and pessimistic side of the policy. And we found that there is one size fit all, but one size fit none for the vaccine certificate. Even we are talking vaccine certificate in Thailand, in Malaysia, in Indonesia, for sure, it may have different in terms of policy implications. So there is the need to develop personalized policy, especially on protocol for travels for each country, and even for between countries that going to agree on this policy. And there is a lot of unknown and uncertainties surrounding COVID and new variants, the vaccine efficacy, and then the public response to this policy. So we need to do plan, do check, act loop. So this is new, and we hope that when we make the governance for this, we put plan, do check, act as a heart of the governance policy. And last one, we hope that this vaccine certificate is only a temporary policy. We found that we don't need it once the world is fully immunized. So we hope that the vaccine certificate will not delay the vaccine policy distributions and deployment, and we will not use it for long. So that this means that the global communities are safe and being vaccinated. So thank you.
Okay, thank you, Professor Yot, for such great work you shared. Yeah, you shared about your study on vaccination certificate, and we have challenges until vaccination coverage enough. We still have not safe. But maybe what is the document fraudulence, or especially paper-based, it will become problem. Maybe this in this seminar we also support about develop mobile certificate that will answer this concern about result. Now we come to the next speaker. Our last speaker for this session, Dr. Aulia Swantika from Universitas Pajajaran. He is a member of Health Economics Working Group, Indonesian Technical Advisory Group on Immunization. Dr. Aulia will talk about benchmarking and formulating health protocol and certificate for international traveling. Before Dr. Aulia present his experience, Dr. Aulia obtained a doctoral philosophy in pharmacoeconomics from University of Groningen. He is now a member of Health Economic Working Group, Indonesian Technical Advisory Group on Immunization. So to Dr. Aulia, please, time is yours.
Thank you, Dr. Hollis. So first of all, I would like to thank the organizing committee for inviting me. So at this at this occasion, I would like to I think there's problem with the voice. Yeah, at this section, I would like to discuss my talk on protocol and certification for international travel.
A noise from background.
Yeah, so this is my presentation outline. So anyone can help me with this problem? Yeah. Anyone?
Speak. Please mute your microphone. I think already clear. Okay, maybe you can proceed your presentation. Thank you. Thank you.
Yeah. So this is my presentation outline. Background, health protocol for traveling, and then vaccine certificate, and several key messages. So this is my disclaimer. I have no potential conflict of interest to report, and those of the individual presenter. Yeah, so let me start from this slide. So in 2017, there is an interesting study from initiated by the World Bank. At this moment, the World Bank assess about the country's epidemic preparedness, and then the result highlighted that in general, specifically Indonesia, is not ready for the next pandemic at that moment. As we can see from the picture, the result of Indonesia's level of preparedness to face the next pandemic is not quite good. We are in a quintile 3, which is not a good rank. And then, considering the result for other countries in ASEAN, in general, the most of countries also have the same rank. Yeah, and then how to mitigate the pandemic in general. So in general, there are 3 scenarios to mitigate the pandemic. The first scenario is about curtailing interactions between infected and uninfected populations. Through this scenario, we can conduct several interventions such as patient isolation, quarantine, social distancing practices, and school closures. And then the second scenario is about reducing infectiousness of symptomatic patients. We can do this scenario through infection control practices, antiviral and antibiotic treatment. Unfortunately, for COVID-19 pandemic, up to now, there is no specific antiviral and antibiotic treatment that have proven to be effective for reducing infectiousness of these symptomatic patients. And then the last scenario is about reducing susceptibility of uninfected individuals. We can conduct this through vaccination. Yeah. At this slide, I'm going to present about the result of the cost effectiveness of COVID-19 vaccines. We use the United States as the reference case. So there is the latest study from the US about the use of cost effectiveness modeling to inform vaccination prioritization. So if we can see from the result of the study, the authors take into account the issues on age-based prioritization scheme or risk-based prioritization scheme. So from those two scenarios, we can see that all those two scenarios can be considered to be cost-effective. And then there are several key points to be highlighted. First is COVID-19 vaccines can be considered to be cost-effective in various two scenarios: age-based prioritization or risk-based prioritization. And then the next is one of the most important thing is about COVID-19 vaccine availability is critical on reducing morbidity and mortality rate. So in the discussion section, the author highlighted that the sooner we get the COVID-19 vaccine, that's the better. And then the last thing is about several factors which can be considered to be the most influential parameters impacting the cost effectiveness value. They reported that infections incidence, vaccine price, vaccination cost, and vaccine efficacy are the most influential parameters. Yeah, and then how about the situation of COVID vaccination in Asia specifically? When will countries be fully covered? Because our concern is about the coverage of COVID-19 vaccination in order to achieve herd immunity as soon as possible. So there is an interesting article from BBC. What's causing vaccine delays in some Asian countries? They reported that there are several factors can make significant delay of COVID-19 vaccination in Asian countries. The most important issue is about the vaccine hesitancy itself. And then if we see from the graph about when will countries be fully covered, we can see here that in general, countries in Southeast Asia specifically, if we apply the current situation as the baseline, the authors estimated that the full coverage of vaccination for Southeast Asian countries to be achieved in late 2022 or from early 2023. I think this is the biggest challenge for all countries in this region to accelerate the coverage of this vaccination in order to achieve the herd immunity concept as soon as possible. And then next to discuss about COVID-19 vaccination. So in this part, we are going to focus on the latest World Health Organization position paper on resuming international travel. I think there is an important statement from WHO in terms of controlling international travel. There is no zero risk when considering the potential importation or exportation of cases in the context of international travel. Therefore, thorough and continuous risk assessment and management will help identify, reduce, and mitigate those risks while balancing the socioeconomic consequences of travel measures or temporary restrictions against potential adverse public health consequences. So there are two critical points to be highlighted. First, there is no zero risk when considering potential international travel. And then the second one is about the importance of risk assessment and management to identify, to reduce, and to mitigate those risks. The WHO already developed a tool to assess the risk for international travel. So in this slide, we can see that how we can conduct self-assessment, self-risk assessment for international travel. So the first question is the projected 14-day incident rates in the country of departure higher than the projected 14-day incidence rate in your country. Please assess it alongside other key indicators when they are available, which the indicators are mortality, testing positivity rate ratio, testing rates, and testing strategy. And if your answer is no, so we are going to move to the scenario one. So in general, the WHO defined three scenarios for this assessment: scenario one, scenario two, and scenario three. We'll discuss it later. And then if the answer yes, that the projected 14-day incidence rate in the country of departure is higher. So you are encouraged to estimate travel volume across all routes. And then you have to estimate potential increased burden of COVID-19. And then the last question is, but does your country have adequate capacities to detect and cope with the potential additional burden of COVID-19 cases while maintaining other essential health services? So in this slide, I would like to highlight that to assess our risk before traveling, so we have to aware with the situation in the country of departure, and also the situation in the country of arrival. So these three scenarios in risk assessment. Scenario 1 means the country of departure has a projected case incidence lower than or equal to that of your country. So in this scenario, maybe the scenario is much better than other scenarios. And then in the scenario 2, the country of departure has a projected case incidence higher than your country, and your country has adequate capacities to cope with the increased burden. So in this point, the WHO highlight the availability of a country to cope with the increased burden. And then the scenario 1, the country of departure has a case incidence higher than your country, and your country does not have adequate capacities to cope with an increased burden. And then talking about health protocol, I think we have a huge variation in terms of health protocol in Southeast Asian countries. So let me use the reference case of Indonesia about the health protocol for international arrivals in Indonesia. So refer to Indonesian Ministry of Health letter in 2020. So this is the flow when the Indonesian and foreigner arrives in Indonesia. So if you has a negative PCR test result, so you need additional health check to body temperature, pulse, oxygen, saturation, and others. And then you need to PCR. You need to do PCR result validation and health clearance. If everything is okay, you are required to do self-quarantine for 14 days. And then on the other side, if you have no PCR test result arriving in Indonesia, so there will be additional check, and then we will see the result from the PCR test. And then if positive, you are requested to do quarantine in selected healthcare facilities, selected places. And then if the result is negative, and then there is the last result validation, and everything is okay, you are allowed to return home for doing 14 days self-quarantine. And then this is another WHO's position paper regarding proof of COVID-19 vaccination for international travelers. So before we are discussing further about vaccine certificate or other documents supporting international travelers, so there is one important issue from WHO. So according to WHO, national authorities can convince operators should not introduce requirements of proof of COVID-19 vaccination for international travel as a condition for departure or entry. I think this is linear with statements from Mr. Cacap from Ministry of from the stakeholder of Indonesia. Given that there are still critical unknowns regarding the efficacy of vaccination in reducing transmission. In addition, considering that there is still limited availability of vaccines, preferential vaccination of travelers could result in inadequate supplies of vaccines for priority population. So there are several points to be focused on. First is about critical unknowns regarding the efficacy of vaccination. And then the second one is about limited availability of vaccines. And then the second one is about inadequate supplies of vaccines for priority populations. And then in this slide, I would like to introduce you with several terminologies regarding the certificate or passport of vaccination or community. So as Prophet already mentioned that I and him are involved in a working group of Croatia. So there are several terminologies we have to be aware. First, it's about certificate. Certificate is more about a document describing the medical situation of the individuals who hold it, combination of electronic and paper-based methods. And then another one is passport. Passport is understood as being a one-stop shop for all information to enable travels. And then how about the vaccination certificate? Vaccination certificate is more about proof of vaccination. And immunity certificate is more about proof of immunity or low risk or of reinfections to COVID-19. And then how about the vaccination passport? It is about proof of vaccination and negative PCR test. And then the last one is immunity passport, proof of vaccination, antibodies following infection, and negative PCR test. I think through this conference, all stakeholders can discuss together which document may be suitable for the setting of Asian countries. And then this is about the smart vaccination certificate. I think the speaker from WHO in the beginning already mentioned about this. I think the main idea is combining digital and paper-based methods for this smart vaccination certificate. And then how about the scenarios? I think the WHO already did a good job. They already provided several scenarios considering the readiness of countries to implement this. The first scenario is about paper first only for the vaccine certificate. And then they also consider about offline digital health and also online digital health. I think it depends on the country readiness. And then the next one is about the result of a scoping review of global vaccine certificate solutions. We can see how about the progress of other countries on implementing a vaccine certificate. So there are several examples that can be learned from the experience of other countries. So let me use the Estonia as the first example. Lessons learned from Estonia. I think as Estonia, in a good collaboration with WHO, they already developed a guard time. I think this is a very comprehensive approach because they also consider the supply chain process since from the beginning, from the manufacturer, and then at the end, the vaccine goes to the patient. So they call the system is a vaccine guard. So vaccine guard by guard time, linking vaccination record with end-to-end vaccination flow. So if you can see from this picture, through this tool, they can monitor vaccines from the manufacturer and then deliver to the hospital, and then how the supply chain report. So this is a very comprehensive. So and then the vaccine guard also connects workflows of different roles and actors. They consider the role of several important stakeholders: manufacturers, distributors, health organizations, and then verifying entities, and patients itself, and also public health authorities. So yeah, I think they also mention about the flow for the vaccine flow and information flow from vaccine manufacturer to the patient, or from vaccine manufacturer, health authority, clinic, distributor, and health information system. And then another example is from Pakistan. They call this Vaxify. This is a good initiative from Pakistan. So in vaccination identity network, they consider medical institutes as the issuer organization based on patients, hospital, and laboratory data. And then for the verifier, they also consider aviation institutes as one of verifier organizations, and then they also connect with a wallet provider, which is Vaxify, which will hold the certificate. And then for the Vaxify certificate issuance, they also consider the role of a doctor who fills personal information and vaccinations details. And then doctor will certify patients identify and other documents. And then at the end, patients will get vaccine certificate through a scans QR code. And then this vaccine also, this certificate also will be verified for those who are going to travel. And then the last one, the last example is from European Union Commission. They already launched Digital Green Certificate. This Digital Green Certificate is a digital proof that a person has been vaccinated against COVID-19 or has received negative test result or has recovered from COVID-19. So digital and or paper format with QR code. And then this is free of charge in national language and English. And this certificate is valid in all European Union countries. So the Digital Green Certificate in practice start from the vaccination or test or recovery. And then someone who already has this, and then certificate will be issued and signed, and then they will got QR code on device or paper, and then the certificate will be validated. So this is my last slide. So in general, I would like to say about two key messages. First is about countrywide COVID-19 vaccination could take years. In the transition phase where population is partially vaccinated, an innovative ecosystem is required for faster socioeconomic recovery. I think through this conference, this is a good moment for all stakeholders from countries in Southeast Asia to discuss together about this innovative approach in the future. And then the last one, mitigating the need of countless integrations among various stakeholders, saving time and funds, while collaborating with existing identity infrastructure can impact post-COVID immunization phase to be faster and low cost. I think that's all from my side. Thank you.
Okay, thank you, Dr. Aulia, for such a very interesting presentation. You show that there is still big challenges for ASEAN countries, especially in terms of vaccine coverage. And yeah, also there is no zero risk in context of international traveling during the pandemics. However, yeah, you saw multiple options of the health certificate for traveling to, yeah, maybe as a solution for during this pandemic before all of the countries fully covered by vaccination. Now we have a question and answer session for all speakers. For panel members, you can raise your hand and ask your question to our speakers. And for participants in Zoom webinar and YouTube, you can text your question, and please write your question to whom your question should be addressed. Before we have 4 questions here.
Yes, many questions. Many questions, Mr. Moderator.
Yeah, many. I'm reading the question in Q&A question from maybe. Eki Milening Tias, thank you for all speakers for the presentation. It's so insightful. As we know, until now, target vaccine for elderly still have a little presentation, although Sinovac vaccine is safe for them. What the factor that make it happen? What is the next alternative way to reach the target? And because we know that elderly people have more susceptible to virus COVID-19. So I don't know, this question is addressed to maybe Dr. Edi Fardiana.
Okay, I try to the question about the elderly. Because the most of elderly already have degenerative illness that might make them not eligible for vaccination. As we all know that vaccination should be given to the healthy person. Yeah, that is answer for the elderly. And then the other thing, it's more important to give information for the family about the important the vaccination for the elderly. So the family don't forget to maybe to accompany the elderly to give the to go to the or as health center to receive the vaccination. That's about the elderly question.
Okay, thank you, Dr. Eddy. Yeah, now we go to the next question. There who do not comply with various health protocols, for example, in India, which is entering phase 3 of
Yes.
COVID-19, many people have contracted COVID-19 in just one day.
Yes.
What the various governments of the world need to do to prevent transmission of COVID-19, even though the COVID-19 vaccine has been given in various countries.
Yeah, maybe this is the situation in India. Yeah. Yeah, as far as I know about the clinical trial, maybe the most important thing when we give informed consent and don't forget to make a good surveillance team. That's too important to study in clinical trial in the field. But exactly the India situation, I'm sorry, I don't exactly know.
Okay, thank you. And then maybe I will I invite panelists in this room to ask.
Maybe are there question? Are there question about the cut-off point?
Okay. Yeah, there is one question about we have cut off protective antibody after second dose of vaccination. I think it's
yeah, this is important about the study because until now there is still no established standard regarding protective antibody titer. So we don't have the cut-off point. Maybe hopefully based on the COVID-19 clinical trial result with performed globally, the WHO can soon release the cut-off point for the protective antibody. But in our study, the cut-off point for the antibody based on the seroconversion and seroprotective. That's all the answer. Thank you.
Thank you, Dr. Eddy. Is there any other question from maybe one question more in the question and answer? Okay. Is the vaccination safe from to traveling? It's from Ani Rohaini. I don't know.
Okay, I try to answer also.
The question, maybe.
Yeah.
Okay.
I try to answer the question because based on our clinical result, the efficacy about 65.3%. So for the traveler, I think don't forget after completely immunization to use the health protocol social distancing, use masker and wash, and always keep in its side to use the protocol, because no 100% the efficacy.
Okay, maybe for other speakers, any opinion or any answer for this question? Is the vaccine safe for traveling?
Yeah, Dr. Hollis, I think I have one additional comment. Talking about is the vaccination safe to traveling? I think considering the WHO statement that even there is no zero risk for doing travel, considering the current situation, the immunization coverage, on the vaccination coverage, I think it is that statement is very relevant. And then talking about the previous question about how to prevent transmission COVID-19, how to prevent how the world need, how is the world need to prevent transmission at this moment. I think the biggest challenge at this moment is how to accelerate vaccination coverage. At one of my slides, I showed how the economist investigator predicted that countries in Asia specifically would achieve the full coverage at least in 2023. So I think this is the homework for all countries in our region to accelerate the vaccination coverage. I think that's all from my perspective.
Okay, thank you, Dr. Aulia. Yeah, we know that it's still maybe prediction 1 or 2 years before we can cover all of the citizens by vaccination. So we need a fast or a quick option for this. So in this case, we propose certificate, health certificate. And then our next question, maybe from the panel members, any question? So you can raise your hand and directly ask to our speakers. Okay, I will read question in the chat box.
In the meantime, can I answer one question from I think Mr. Purwanto?
Okay. Yeah, Doctor. You can answer directly from Mr. Purwanto. Lesson learned from many countries. Please kindly elaborate. Feasibility study from ASEAN, if it is. Yeah, please, Dr.
Okay, so answering this question, as I already mentioned before, that there are several terminologies which are relevant to use in terms of vaccine or immunity certificate or passport. I think following the result of study that Dr. Yat already conducted in Thailand, I think the stakeholder in Thailand prefer to use the terminology of vaccine certificate to be implemented in Thailand. I think comparing the benefits and comparing the advantage and disadvantage from these four options, I think vaccine certificate is the least how can I call this? I think vaccine certificate is the most realistic to be implemented in the short term. I think that's my answer.
Okay, thank you, Dr. Aulia. Maybe Dr. Yot, any additional comment for the question?
I just elaborate. I think the justification behind the Thai stakeholders prefer the vaccine certificate, because I think at the moment the whole country we have only 30 to 40,000 people infected, and that is only a minorities, and they're afraid that if we allowed people who already infected without vaccines to get certificate, that might be the case that is will have incentive for people who may wait for long to get vaccines and then to get vaccine certificate to export themselves to the virus, so that they can bypass getting the certificate without getting the vaccine. So I think this is something that many stakeholders don't want to see in Thailand. So they prefer or focus on the vaccine certificate rather than immunity certificate. Regarding on the passport versus certificate, I think it's quite similar in the term, but I think many stakeholders may consider using the vaccine certificate for many purposes, not only the traveling. So they may prefer to get it in general term and the document less formal, so that they can modify and adjust in the near future. Over.
Okay, thank you. There is two other questions. Is there non-neutralizing and neutralizing antibodies that could be produced after vaccination? Is there any information regarding confirming level of neutralizing antibodies in vivo after vaccination as the requirement for immunity certificate or passport? Or the total antibodies is enough for the evaluation? Maybe Dr. Edi Fadliana.
But about cut-off point until now, we don't have the cut-off point, the antibody level after receive the completely immunization. I hope from the global trial, the WHO can make a cut-off point as a standard. But in a study, the use of the protective level use seroproteksi and seroprevalence also. So the answer is until now, we don't have the cut-off point of the protective antibody.
Okay, thank you. So the answer is we still don't know about this condition. And
there are other questions about the quality of the vaccine.
Yeah. Oh, about the variety of vaccine COVID-19 supplier, is there any requirements in Asian countries for vaccine certificate from certain vaccine supplier recognized by WHO?
Maybe Dr. Aulia, that's question for you, maybe.
Can you repeat the question, Dr. Hollis?
About the variety of vaccine COVID-19 supplier, is there any requirements in any ASEAN countries for vaccine certificate should be from? Is there any specific supplier or should be from vaccine supplier recognized by WHO or how?
Okay, I would like to try on answering this question based on the latest study from USA, which focus on the cost effectiveness of COVID-19 vaccine. So I think there is one interesting result from the study when they made several scenario, and then they consider that the better situation at this moment, ignoring or did not take vaccine efficacy differences from several available COVID-19 vaccines into account, the better situation is to achieve to get vaccination as soon as possible, because no matter what the vaccine efficacy, as long as it is approved and then more than threshold that set by WHO for the vaccine efficacy, I think it will not be major concern, because the most important thing is about how we can get vaccination as soon as possible. Yeah, I think maybe that I hope that can answer the question.
Okay, the key point is coverage of vaccination is the most important. Okay, yeah, we have one question, last question maybe. As ASEAN is pursuing a travel corridor arrangement framework, should ASEAN adopt one of available digital platforms such as IATA, Travel Pass, or develop its own digital platform to facilitate the information exchange? Which criteria or requirements should ASEAN consider when it decides to address the question? Maybe Miss Yong?
I can't really comment much on this because it was mostly on the ASEAN part, but what we can say that the ASEAN committees, under us, the tourism and travel, we are looking into this, trying to come up with something like the travel corridor arrangement framework. Yeah.
Okay, thank you.
Yeah.
Okay, we have another question for Dr. Eddie. After vaccination has already introduced in large scale, how about the real vaccine efficacy so far? If it has done,
okay. Our study efficacy only based on the 3 months after second dose, but now still continued until 6 months. I hope the efficacy more larger than before.
Okay.
And the other question about the quality of the vaccine, maybe.
Okay, I think Dr. Aulia already answered that, quality of the vaccine. Have you you have other opinion about this that question? How about the quality of the vaccine? Is there any other opinion, Dr. Eddy?
Yes, I try to answer to know how the quality of the vaccine, good or no. Don't forget to know about the immunogenicity, safety, and efficacy. So 3 parts this important thing. For example, for study Innovac, in my study, the safety about 30% local reaction and systemic reaction with mild degree. So it is safety. And about immunogenicity, about more than 90% or 99% who have after second immunization, who reach 19% for seroprotection or seroprotection or seroconversi. So it is very, very high. And then the efficacy about 65.3%. So in my opinion, the quality of the vaccine is good because the 65.5% is up from the WHO limit is 50%.
Okay, thank you, Dr. Edi. I believe that all questions already answered. So, one last question. If we are going to enter a country, will there be a possibility they will check our antibody level to COVID-19? If we are going to enter a country, will be there a possibility they will check our antibody level to COVID-19?
I don't think that can happen. If they need to do this, I think it will be very difficult challenge for travelers. And at the moment, you know that the WHO have strong positions against any test, any certificate, any passport for travels. So at the moment, we still have a lot of unknown and uncertainties. Even we identify the potential of an IgG anti-spike can be used to look at the level of immunity protection for COVID, but we don't know regarding of these measures against new variant too. So I don't think it will happen, at least in the near future. Thank you.
Okay, thank you. Yeah, maybe I don't know. There have a lot of questions already, and maybe we now come to the end of the session. Let me a little summarize for this session. Yeah, vaccine until now, vaccine coverage is still limited, so we have to wait until another 1 or 2 years to cover all the required immunity level for the citizens. So we have to act. We have to act for solution. Yeah, we need a rapid solution or a fast solution for at least until we have fully covered by vaccination. Of course, in this session, we have options for our traveling in ASEAN by promoting a health certificate. Many options has already proposed, and already some country already implement that health certificate. Probably we will have our ASEAN certificate soon. Thank you very much. I will close this. I will close this session by quote: COVID-19 is no longer a problem, but it's already part of our life. So we have to go with it. Thank you very much for all your attention. Sorry for this, for any inconvenience during this session. maybe to do. Yeah, we will have another session, opinion and statement by country representative, and this session will guide by Dr. Roni Lasmana, MD, MCAS IPO PhD. To Dr. Roni, please, time is yours.
Yeah, thank you so much, Dr. Hollis, for nice introduction. Honorable distinguished speaker, honorable guests, invited representative, and all participants today. Very good afternoon. Salam sejahtera buat kita semua. I do believe that we are really enjoying our meeting from morning till now. So I'm very happy that since we discussed in the morning, at the very beginning, we have the objective of ITTP COVID-19 is to build a common platform for us to be able to exchange our ideas, insight based on the research, experience, formulated the policy recommendation, and to identify some relevant technologies to support the recovery plan after COVID pandemic. The initiative will be implementative not only for us, but for our peers and friends in the Asian country. Thus, we need to have one common word and perspective how to deal and make a strategy with this COVID-19 pandemic. As the university, as government, we need to support with the analytical capacity based on our academic background and support the community and the government to make the policy from the local, national, even international level, how to conduct this one. And then we believe that COVID-19 will not be able solved by only national boundaries, but more broader than that, we need friends, peers for the regional and international to be involved and to collaborate to make this strategy. But before we hear the very good statement for each country, and then we may get more understanding about what should we do as a plan for combating or for dealing with this pandemic, I would like to invite friends for shared screen today. And then as we see in the screen now that we believe several issues that COVID-19 pandemic will not end soon. Honestly, this is come from the slide from Professor Eko, but we know that in the morning, Professor Eko faced some difficulties due to internet connection. So let me reinforce only two slides from Professor Eko's slide before we hear the opinion from representative country. COVID-19 will not end soon, as we know, and can be fewer even more. So we need to have a very good strategy on that. Cross-border mobility is required to increase the economic, social, education, and culture activities. It's not only talking about health. Definitely health is important, safety is first, but those health aspects impact to the other aspect. This is what we need to consider. So seeing those important, the policy brief for ASEAN Smart Mobile Certificate has been drafted. So we want to hear a feedback of this draft. We didn't say that this is 100% will be the form of the consensus that we want to decide today, but this is one of the entry point for us to think over. This is not talking about one issue, but whole aspect. So we need to really consider about it. And Smart Mobile Certificate is not a vaccine certificate. Please underline about it. It is to enable cross-border mobility with the implementation of secure, comfortable, and high-level health protocol. So this is make more confidence, not only for the regulator, like government and university, which is have really high interest of how to take care and control of the other aspect, but also for the traveler itself. Survey is currently being conducted to obtain the feedback for ASEAN country member. So still we gather and collecting input. So don't forget to fill in all the bit.ly and the survey that we try to circulate to all of you. And then webinar and final survey will be conducted on 24 April. So today there is a webinar to showing you how what we have doing in the general survey, so we can get the feedback and make it more sharp. Country representatives invited to give the opinion and statement. Would you mind to continue with the next slide? And then as you've seen over here, there is a current practice and proposed practice. It In the current practice, there is a departure and arrival, which is need a COVID-19 antigen test before departure, and then COVID-19 antigen test for 72 hours. And then there is a PCR test, and there is quarantine point needed. And the other proposed practice is whether we can short the protocol and then make a consensus and agreement how we deal with the antigen and PCR tests, and make some more friendly for the user and traveler in ASEAN, and how to reduce the risks. Definitely, safe is number one. We want to have the safe issue is number one, but how to deal with the issue that we get the safety, but we get how to make a strategy so impact to the other aspect can be handled well also. So we come with the idea whether we can tracking and then give a no quarantine example if we have some tracking lab result and so on. Thus, based on those situation and then based on those issue and ideas, we are really welcome now to hear the opinion and the ideas. I would like to first invite friends from Brunei Darussalam, Professor Muhammad Ayub Siddiq, to open your mic, and we are happy to hear your opinion and statement. Please, Prof. Time is yours.
Yeah. Bismillahirrahmanirrahim. Assalamu alaikum and a very good afternoon, everyone. I hope you can hear me well. Yes.
Yes, I can hear you well, please.
Okay. Okay. It is very fortunate that to be part of this very important initiative, and all distinguished speakers have highlighted about the negative impact of this COVID-19. It is not just about health impact. There is a huge impact on the economy. There is no question about it. So as we know more and more about the virus, and we are now thinking about the recovery strategy, and one of it is one of the very important one today. We are talking about this smart travel certificate. So to me, the from opinion point of view, this is the very useful and very helpful for our recovery, what we call strategy. Yeah. This is point number one. In terms of risk and concern, I think WHO speaker also mentioned about the vaccine certificate document fraudulence and needs for verification and validation of all these documents, certificates, and so on. But again, I believe that these can be overcome with our current data security technology and all these things if we all work together. So apart from that, I do not really have a much risk on what you call a concern about it. But in terms of mitigation and strategy, I'm a little bit what you call a few suggestions I have. Yeah? It is very much uncertain. Even though we know more about the virus, there are still a lot of unanswered questions. Vaccine efficacy and how much the what you call the immunity will last in the body, and at the same time, what you call the nature of the virus, the mutation of the virus, a new variant, and so on, which may have effect on also the vaccine efficacy. So all these are a bit limited data. So if we are trying to make decision for what kind of protocol and so on at this stage, I think it might be quite difficult. Even the WHO is having day to day, they have to update their standing guideline or protocol, or depending on the more and more knowledge that we have about this virus. So I would leave it to every country authority. Every country have an authority and a technical committee. So for example, in Brunei, we have a health authority and together with the other ministry as well to make the decision for people traveling and so on. I think ASEAN can organize together with all these technical committees so that this SOP can be very well formed and make it happen. Yeah. So at that time I'm sure also all these countries authorities are also working closely with regional WHO. So we can quite possibly set all the standards SOP especially. And so in terms of the statement, yes, we very much agree for the development of this ASEAN Smart Travel Certificate. Yeah, it's a very good idea. It's very timely to start with. Again, as I said, with regard to technical matters, I think the respective country technical teams can closely work together finally to decide for SOP. Thank you very much.
Thank you so much, Professor Ayub Sadiq, for your very nice statement that clear enough for us that this is may be really useful and important. However, there is several points we need to really consider, work closely with the authorities is one of the factor. So we will hear another opinion from our friends from Cambodia representative. I would like to invite Dr. Che Chan Earn. Please open your mic and we want to hear your opinion, please.
Good morning.
Good morning.
Yes, you hear me?
I can hear you clearly, please.
Yeah, thank you for the organizing this very important event. This is, very successful organized. I participate in the mornings till now. Very love to hear from all the speakers, all the comments. So this is very good idea for, having the recovery strategies for this COVID-19 situation now. I think we do on the right time, and I don't have much opinions now, but because many speakers mentioned a lot of things and we learn a lot. But I think this is very important for smart travel certificates because it will, improve a lot of things, including economics, industry, also the tourism, and also the mobility for the students, and also exchange research activities. So we need a lot of travel and work together among ASEAN countries. However, we can see a lot of risks also, but I think those risks can be, mitigated by using, ASEAN strategy, working together, as the unities of ASEAN. So we're thinking about, about the data, about the securities, public safeties, and privacies of the people in Southeast Asia countries. And because we know that the situations or the capacity from one country to another country are not the same, so we need to, standardize all SOP to mitigate the risk. I think we need to mitigate all the risks. I think government-to-government agreements or ASEAN's networks for this activity need to be in place. And also we need to propose a realistic SOP for the travels overseas certificates. In many things, many parameters are still uncertainties and really unknowns of, the pandemics. So a lot of things now, from country to country, they practice a different, strategies. So we need to have, at least a standard of the SOP. And also adopt technologies for improved health system for all the ASEAN countries. It should be one of the mitigation strategies that we can, understand more each other's in terms of a health system from different countries. For the statement, of course, we are very happy, and we discussed among our group here also from our university. We said we agree with this initiative is very important on the right time, but each country have their own unit or their own ministries that are working very close on this pandemic issue. So the policy brief we also need to align with the national regulations and of each country. So for this work, we need to work closely with the authority of each country to make sure that we are aligned and with everyone can apply. So this is all from Cambodia, and thank you very much. And we are very happy to join this and wish all the success for the conference in the near futures. Thank you.
Ah, very good statement. Thank you so much, Dr. Chai. We are very happy to hear. And I think the same issue of the limitation and risks we need to really consider. But before we try to summarize and see what is the overall opinion, I would like to invite peers from Indonesia, my colleagues and my senior, Dr. Agustin Kusmayati. Would you mind to open your mic and please go give your statement?
Okay, thank you, Mr. Ronnie. Yeah. Okay. Good morning, good afternoon, everyone. Greetings from Universitas Indonesia in Depok. It's really a pleasure for me to be here and meet all of you and discuss these very important issues. Let me now share my screen. Will you please stop the previous screen share so that I can share my screen? Okay. Okay. Yeah, ASEAN Smart Travel Certificate. I think this is really, what to say, really burning ideas that are really important to be discussed and could be really also important to be implemented, to be developed and implemented. As you know all that COVID-19 pandemic is a borderless event. It affects all aspects of human life, not only health, but also education, economic, social, culture. Every aspect of human life are affected by this pandemic. And we also understand how people mobility is fundamental for the people survival and development. So it's also true for all of us, the Asian countries, especially for us, the neighboring countries in Asian region. The inter-Asian countries mobility is unavoidable. And I think it's also crucial for an effective recovery for the region. In this case, I'm thinking that the idea of developing a standardized health alert system and also a standardized or one travel certification criteria are needed. And since we are this standard will be applied across border, then it should be supported by a smart technology so that we can apply, we can implement the same standard, the same system in the whole Asian region. So in this case, I see some concern about developing this standard or this system. First is about the privacy and confidentiality of the data, because we are using data or we are gathering health data of an individual, so that we have to respect the health data of individual as a privacy and as a confidentiality of its individual. And then the second issue is the data property. Who own the data? Who manages the data? Because it's very possible that the data can be misused. The fourth concern is the credibility. Whether the system, if we agree to apply the similar system in the whole region, whether all countries, all parts of our countries have, let's say, good credibility. Includes also how the truthful, the people in our countries in providing data so that they give us the correct information. The next concern is the validity and accuracy of any methods, instruments, processes, and procedures involved in the system. For example, if we agree to use one of the criteria is the result of PCR test, swab PCR test, then we have problems with the validity and accuracy of PCR tests in our countries. The next concern is the capacity of supporting systems in each of our countries. For example, the lab facility, the internet connection, the servers, the interoperability of the hardware that we have and the system that we have. Those are some concern that we have to take into considerations. And last but not least, the data or the conclusion that will be made by the system can result in wrong perceptions among the user, among the travelers, and they think that they are safe, and in this case it will lead to the wrong attitude and behavior of the travelers. So this is really important and can raise another problems. So my suggestion is the first one is how we can develop an appropriate protection for data privacy and confidentiality, as well as protection from misusing of data. We have to treat the data similarly to other health data. The second, I propose that the data is stored and managed by each own country, but other countries trust it and have an access to use it for making for decision making. And then the next is I suggest that each country should ensure its own credibility within in the country of its people also. The next is standardization of any method, instruments, process, and procedures involved in the system once we already set up the health alert criteria and also criteria for travel certification. My next suggestion is that each country should ensure adequate support systems. For example, the lab, servers, internet connection, interoperability, and includes also quarantine facility, isolation facility, etc. And then don't forget to conduct appropriate communication, information, and educations for the users, for the travelers, to prevent wrong perceptions, wrong attitude, and behavior. And then last but not least, of course, the ASEAN countries should discuss and agree on the health alert system, one health alert system, and one travel certification criteria. And this system and criteria should be regularly reviewed and updated. So based on what we have discussed and agreed, then we can develop later on the smart mobile system to support the implementation of the health alert system and travel certification criteria. So our statement is that first we agree that ASEAN develop and apply one health alert system and one travel certification system to be applied in the region. And we strongly propose Asian countries to use information and communication technology to support the implementation of the system. But we require Asian countries to protect the privacy and confidentiality of the travelers' data and apply cautious management and valid use of the data. We also require Asian countries to ensure the validity, accuracy, and credibility of the system. And last but not least, we strongly encourage Asian countries to develop and implement the system based on mutual respect and trust. I think this is all what I can share for today. I really hope that we will continue with the next process so that at the end we can really develop the health alert system as well as also the smart travel certification system. Thank you.
Thank you so much, Dr. Agustin. It's really enlightenment and a lot of things that I think really, really important for us to really consider. But before, again, we wish to hear another opinion from France, from Malaysia, Associate Professor Dr. Muhammad Rafi Baharudin. I will invite you to open your mic and then please give us your statement. Thank you.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And very good afternoon. First of all, I would like to say thank you to the organizing committee for this very important webinar, and this finding could help Asian country to travel if this particular permission by each country can be accepted. Now, I'm Muhammad Rafiq Baharudin from University Putra Malaysia. So our opinion on this ASEAN Smart Travel Certificate is that first of all, we are talking about travel with confidence. And one of the presenters this morning saying about we need to have some confidence when traveling due to so many incidences of COVID-19 around the world. So this might be, we don't know when this particular pandemic will be stopped, and mobility of students, business travelers, other industries could be affected due to this pandemic. So there must be a way for us to go in terms of seeing this problem. Now, the second opinion would be it is good to have this certificate because, when we talk about safety culture, when we talk about health culture, until today, people are, a little bit lacking in promoting their own hand or personal hygiene. So with this certificate, it is indirectly will promote hand or personal hygiene among travelers. In order for countries in reducing their numbers of COVID-19 cases, apart from vaccination, apart from strict, movement, the most important thing that people might lacking in developing the culture is on the hand and personal hygiene. So definitely the opinion will look into this, and we are agree if this particular certificate will boost indirectly personal hygiene among travelers. Now, talking about the risk and concern regarding this smart certificate is the perceptions of individuals. If let's say it is not mandatory, some people might say it is going to be a voluntary compliance. So it doesn't seems to be a good enforcement later on. So the risk is to look into the mandatory compliance. What are the elements of compliance that we need to fulfill? For example, if let's say someone get offended due to certain criteria, what would be the punishment of, say, making a false certificate? You see, so this is another thing need to be looked into. What are the penalties should be given if let's say there is some difficulties or some fault being looked into this matter. And then we are aware that there are many issues in security, especially mobile apps. There are a lot of hackers here and there. And now in many countries, a lot of false certificates, a lot of false swap test certificates, right, being distributed, even though they selling that to get some money. So I think the security of the mobile app needs to be very stringent in terms of okay, right. And then the third one would be the financial implication for each country. Even if I'm not mistaken, just now we are talking about non-government officials, sponsorship and so on. But when we talk about long-term mobility, we are talking about maintenance cost of the server, maintenance cost of everything. So this is going to be another challenge. And then not to forget the vulnerable groups of travelers. So does this certificate take into considerations of issues when someone who are very sick, traveling, or or babies or toddlers with some comorbidities, for example. So how does this certificate would help to comfort their traveling activities? And then the other issues is if let's say someone would like to go to 2 or 3 ASEAN countries in a very short period of time. For example, someone going to Indonesia and then come back to Malaysia and then go to Myanmar, and then go back to Brunei. So what would be the criteria of interval when we talk about the validation? Does one certificate fit all countries within such a period of time? So this is need to be looked into. And then the other one is if we have that particular smart certificate, what about the certificate of immunity? For example, if a country being locked down, for example, and we are traveling in that particular country, what is the immunity of having that certificate? So this also needs to be looked into. And of course, some suggestions to overcome that is this should be mandatory and agreed by each government, and look into whatever legislation, regulations need to be properly looked. And then, of course, we are, a pilot run should be tested on this in terms of finding some defects in the system. So on behalf of the University Putra Malaysia and other colleagues, we agree with the proposed policy if comprehensive study concerning the risks are well covered. Thank you very much. I pass over to the MP.
Thank you so much, Professor Baharudin. I think a really, really bold and clear statement that there is a judgment and comprehensive study beyond the policy before it's implemented. I agree with that. But before that, we want also hear the opinion from Philippine representative Professor Shannon Alfonso, or who will be represent of him. I would like to invite you to open the mic and share about your opinion. Please.
Hello, thank you, Dr. Rani. Bismillahirrahmanirrahim. Assalamualaikum and good afternoon, everyone. Hope everyone is in good health and always stay safe. I hope my voice is clear. Okay, so my name is Nabil from the ITTP COVID-19 Secretariat team. It's nice to meet all of you here today. I hope everyone is still enjoying this important webinar. I will be reading out the opinion and statement by the Philippines country representative provided by Prof. Sinon Alfonso from the Ateneo de Manila University, Philippines. Prof. Sinon sends his regard to everyone. At the moment, he has to attend several emergency cases at the hospital, which explain his absence here today. So I'll start with the opinion. Safe cross-border mobility is important for global or regional economic, sociocultural, and educational development. In a pandemic, however, such as the COVID-19, that has already claimed over 1 million lives globally, public health, safety, and wellness take precedence over economic, sociocultural, and educational development. Hence, during this pandemic, cross-border mobility for whichever purposes must ensure the health and safety not only of the traveler but also health and safety of both the communities of origin and of the destination. Modern technology has effectively brought the local and regional communities in closer relations and collaboration across global and regional borders since actual travel. Maximize use of technology and minimize safe cross-border travel significantly mitigate exposure and transmission of COVID-19, while at the same time achieve the same goals. So safe or smart cross-border mobility must cover all three, not two, segments of travel, which are origin, travel, and destination. Next, please. So for origin, the safety protocols include show no signs and symptoms, must be vaccinated, valid RT-PCR negative for 14-day quarantine and certified, conscientious practice of health protocols, which include mask, shield, and distancing, portable health insurance that will also cover COVID-19. For travel, this include conscientious health protocols, N95 mask, face shield, and 1.5 to 2 meter social distancing. Secondly, non-enclosed compartment, which include airport, airplane, bus, airport tube, etc. And no crowding, eating together, common or public toilets. So for destination, there must be no signs and symptoms. The travel certificate, green zone restriction, question mark, no crowding and unprotected eating together, conscientious health protocols, N95 mask, shield and distancing, and also contact tracing using QR code. So for the statements from the Philippines, they agree if all of the safety protocols in all three segments, as said before, of cross-border mobility are covered. Maximize information technology application to accomplish the task and achieve the same goals. Minimize actual cross-border travel, delimited to those activities and objectives that cannot be done and achieved without face-to-face. Finally, use of personal protective equipment and conscientious practice of standardized safety protocols are agreed upon. I think that's all. Thank you, Dr. Reddy. Back to you.
Thank you so much, Mr. Nabil, for reading out the statement opinion from the Philippine representative. For the next opinion, we want to hear and we invite the Singapore representative, Professor Teo Yik Ying, to give opinion for us. Please open your mic. Time is yours.
Thank you very much, Chair. So it seems like we are the only one that was a little bit more concerned about the current ASEAN Smart Travel Certificate, because I do see that presently what has been defined is that there would be no quarantine that is advised. And firstly, we do think that the ASEAN Smart Travel Certificate is vital. It is of crucial importance because it will permit cross-border travel to resume, particularly within ASEAN. And there is going to be this dual challenge between the economy, like what we have heard from our colleague in Malaysia that shares some of the economic concerns, versus the priority over public health. And the reality is that there remains a very high risk of importation, particularly with now variants of concern that is circulating around the world, emerging from different parts of the world, whether it is in Asia, in Europe, or in Latin America. So travel will remain the primary mode where variants of concern will enter different countries. So it is imperative that any travel certificate remains stringent enough to minimize the risk of such variants of concern entering, because otherwise there will be genuine risk of further vaccine breakthroughs, particularly with more and more mutations happening that appears to be resistant to the vaccine. So our main concern with the current Smart Travel Certificate as outlined is that the present proposal actually does not appear to adequately protect the public health of communities as well as the travelers themselves, given the requirement of no quarantine as well as very little testing requirements. And there is definitely, as what many other colleagues from different countries have already shared, the challenge of validating as well as accrediting the test results. That how do we ensure that the test results can be shared in a manner that makes that the results are safe, secure, and confidential. In terms of how we think we can mitigate some of this concern, is really to have a very comprehensive approach towards risk budgeting when it comes to travel. And that means how we approach the problem of assessing risk as well as putting in place the community measures to mitigate risk. And again, this is where we are looking at the risk of community transmission that are ultimately linked to travelers that are coming into a jurisdiction. And we strongly agree that there is a need at the ASEAN community to establish national standards on how do we accredit test facilities, as well as the information system for capturing testing as well as vaccination data, and also to allow this data to be accessed. So based on the current proposal that was shared, that Professor Iko has shared earlier on, we actually do not agree with the current proposed policy as it currently stands. And we do believe that there will be a need for further modifications to the policy. And in fact, I've observed that the opinions shared by all the countries previously actually were aligned with this, that they agree with the proposed policy, provided that there are major changes, particularly in terms of respecting national arrangements and national protocols. So I think the note that I would make is that to highlight the importance of performing the appropriate risk assessment such that it properly captures the community situation from countries, not just within the host country, but also from the host countries of travelers from where they originate from, with also the option to quarantine for high-risk travelers. I do accept the point that quarantine causes massive disruption to travel, as well as whether it is leisure travel or to business travel, and that has a significant impact to the local economy that is reliant on tourism. But we do need to look into addressing this concern and the very delicate and difficult balance between public health as well as border reopening. So with that, over back to you, Chair.
Thank you so much, Professor Theo. I think this is really opening and then highlighting important point of this meeting. This is the reason why we brought out the ID for discussion in the meeting, so we can really highlight and it can stand for constructing something really important to be implemented for the regional area. Anyhow, before we try to conclude, I want to invite other friends, representative from Thailand, Associate Professor Dr. Takang Wong Sirikot, to open your mic and give your opinion, please.
Thank you very much, Mr. Chairman. I would say good morning. It's still 2 minutes before noon. Thank you for having me to share the idea and opinion regarding the Smart Traveler Certificate. So I bear in mind that Smart Mobile Certificate or Smart Travel Certificate is not the vaccine certificate. So this is the opinion on that main statement. So definitely, I totally agree about the importance that we need to have some kind of agreements that how can we travel within ASEAN especially. So the importance of the Smart Travel Certificate will be elevating the business activities. That's definitely, in terms of the research and education, is also promote the student and staff mobility as well, boosting the tourism industry in ASEAN. However, it comes with a risk, and it's very important risk. Like the professor before me was saying, that it's about the public health. That's the most important part. But I would like to show you another different view that might also have a risk on that one too, which is about the data privacy. We're talking about the geolocation tracking of the people that traveling in ASEAN. If we want to do some kind of the Smart Travel Certificate, we need to record where they travel. That definitely will be one part of the I would say of the mobile application or application that we want to develop. The second thing is related to the public health problems. So we're talking about the reliability of the different diagnostic tests. Like we're talking about the antigen test, like this morning, many speakers were saying about the different tests that we can be used, but the reliability of each of the tests will be different. So which one we're going to choose, that will be one of the risks that we need to concern. There will be other data related, data privacy problem that we need to concern. For example, the insufficient data that will be provided. If the data is provided, and how will be the public safety of fake data that enter to the system, how we cope with that one. I believe that every country in ASEAN, we have some kind of data protection officer that will be taking care of the data recorded in the system. So if we plan to do some kind of smart travel certificate, so we might need to think about the ASEAN DPO, which is a big agent that we're taking care of all the data that we recorded in the system. So the mitigation or suggestion, so definitely if we're talking about the smart travel certificate, so we might think of the geolocation tracking within ASEAN. Second one will be the COVID-19 vulnerability and risk assessment. And definitely we need some kind of G2G agreement, especially in ASEAN agreement. So I would say it's my personal opinion, but it might be the same with others or might be different. But at the moment, I would say I agree with the smart travel certificate with the note, and it's important notes. First thing, which diagnostic test will be the one that we agreed in ASEAN? That will be the most important one. So the second one, how do we do the COVID-19 vulnerability and risk assessment? Which one will be the best one? Not just only a simple question, do you have fever and those kind of things? That will be a very basic one, but how can we get a more crucial one? And very high concern of the data privacy of the people that using the smart travel certificate. Like this morning, I also heard from the news, like in Europe, they are starting some kind of this smart travel certificate as well. I actually captured one of the picture from one of the application in Thailand we call Mochana. That's the one that's very, very similar to the ASEAN Smart Travel Certificate that's been used in Thailand already. So I was talking to Professor Iko that probably if we go ahead with this one, so that will be one of the starting point as an example for the ASEAN Smart Travel Certificate. So that's all for me. Thank you very much.
Thank you so much for your statement, Prof. So we will continue for the next and last but not least, this is our friend from Vietnam. I would like to invite Professor Dr. Pham Nu Hai to open your mic and please give your statement for us. Thank you. You need to unmute your mic first, Prof. It's still muted.
Thank you very much. You hear me?
Yes, I can hear you now.
Yeah. Thank you very much. The organizer for allow me to participate in this very important workshop, and as it drives our development in the pandemic future. As you know, at the present time, Vietnam have not yet the case infected in the community, but the COVID-19 had a great effect on our life and our work today. For example, the connection of our country with another world nearly cut out. So we live nearly alone inside of the Vietnam. I'm just surgeon, so I'm not epidemiologist. So I'm not specialty in the field how to control the COVID-19. But I think we need to develop some measure to continue again COVID-19, and we need until that we need to live with the COVID-19 until we can find out some method to control the virus. It's my opinion. Thanks for your attention.
Thank you so much, Prof. Nahai. Thank you from Vietnam. Thank you so much. So since all the representatives from 8 countries already give their opinions, please allow me to give a brief summary of what has been presented from its opinion from each country. So, as you know, the important and the hard mission of the ASEAN Travel Certificate is important. Definitely, all of us is agree with that. However, to release some strategy and protocols, there is some important consideration need to really think over and put in the system. And then whenever we create a system, it's supposed to be like it presented also from Dr. Agustin from Universitas of Indonesia. It need to be using a technology enabling everybody to access that, but also in other side is protecting the data. So it's covering the safety of the data itself, the accessibility, the regulation, and creating the system and the agreement and protocol across boundaries the country definitely need to have G2G sit down together and discuss about the issue. However, even though this is a really, really good and important issue, I think all of us is agree. I understand that one consideration, if we look at on the draft today, there is a lot of point that we need to think over and then make it more details and stringent maybe in some point or loose in some point. Because as Professor said in the statement from Singapore, I do believe Professor Theo mentioned that some of the public health issue in the country of origin and country of host who will receive the person move from one area to the area is also need to be considered. Therefore, quarantine time may be one of the issue that we need to have a scientific justification how we define that, and then this is will become our protocols for in Asian country. Nevertheless, if we see from the beginning till the end of the statement from each country, everybody understand that everybody agree that important of health certificate among the ASEAN in regional area, it may be compulsory. However, its implementation, timing, and detailing, this is one of issue that we need to sit down together. Not only the government, but also the expert in the field that really correlated with this issue. Because it's not only responsibility of the health sector, but also responsibility of all of us in every aspect. This pandemic is really impacted not only health aspect, but many aspects. Thus, hopefully by the serial ITTP that will be held in the August, we will have more comprehensive input and then opinion that we can construct together, sharpening, prepare ourselves better to facing this long run of pandemic COVID-19. So we can be able to make sure that our country not only be survive in regional area, but also be able to beneficial and impacted helping other countries other than our region to also facing with the same system or policy. I do believe our data, our discussion, our opinion, and our scientific justification is not only lean on and stays in the room as a part of point of view and discussion. I do believe the chairman, Professor Eko, have been discussed with me, and we will want to put it as a scientific result, as a journal publication. So this is everybody can read that and justification about the perspective, even more comparable and then more solid. This is the thing that I can really put as underline that health certificate definitely possibly is important for all of us. We need to think over because it's not impacted the health aspect, but also other aspect. But indeed, health aspect is the priority, important, need to be both safety is coming first in every ways. And then how to put the safety coming first in every ways, but we put in the right corridors and enable everybody to move easier and also to connect borderless among the country like before the pandemics. This is challenging. This is not easy. This is need a lot of people involved with us. And then this is our job as academician and as part of the people in our country, how to survive and how to support and how to live with the pandemic. Not we suffer, but we will overcome the pandemic COVID-19. And then I want to inform you one thing. After this, we will have a short break. So for 30 minutes. So again, I repeat, we will have a short break for 30 minutes. We will start over by 12:45. So if you are Muslim, I know you will need to have time for prayer in the afternoon. So you can utilize your 30 minutes for prayer because this is fasting period. But if for friends who want to take short break for lunch and then for take a rest, we are very happy to give you that kind of short access to get some rest. But after this session in 12:45, we will have three other speakers will reveal the first brief survey of this topic. So there is some prominent speaker who will come and join with us. There is Dr. Brian Prahastuti and Dr. Masita, and also Professor Dr. Asli Yahya. Thus, I encourage you to, if you be able still have time with us, stay until the end, because this is really important for all of us. I'm very happy to really assisting until the end. And I can inform you, this is one of the meeting, which is I can consider and see from the beginning until now, the participants stay still in the Zoom room till this second. So if you wish and then want to know about the brief survey that we have been conducted in these several weeks, so we will open and then present it by our next speakers in the next session in 12:45. So without further ado, I want to postpone this meeting for 30 minutes. So see you in 30 minutes, 12:45. Thank you so much. Good afternoon. Thank you. Very good afternoon and welcome back in our webinar series today about health certificate in Asian traveler for Asian traveler. So I'm very happy that I be able to see all of you again in this last session for today. Last but not least, because this is very important. This is we will reveal what we have been discussing in the morning and what we have been heard about the opinion about the health certificate proposed and the feedback that we heard from the expert from its country and representative from its country. And we have been done a little survey for this draft proposed health certificate, and then we get some feedback from our survey. Thus, without further ado, I want to welcome my senior, very prominent expert in her field, which is public health. This is Dr. Brian Sri Prahastuti, Deputy General of ITTP COVID-19. So the event is one of the initiator is Dr. Brian. Thus, she will present for us about the brief survey that have been conducted several weeks ago. And then this will be enlighten us and then give us more information about how it's look like and what is the advantages and disadvantages and what next. So without further ado, Dr. Brian Sriprastuti, time is yours.
Yes, thank you very much, my colleague, Dr. Roni Lesmana. So good afternoon, all of my colleagues in here, the honorable guests, and also my senior and other colleagues. As already introduced and also explained by Dr. Roni previously, so my turn now to share to you about the preliminary result of our and also plan of our survey related to the formulating the policy brief for the health protocol and certificate for ASEAN traveling. Yeah, so it's already introduced also by Dr. Lesmana that currently I'm appointed as a Deputy General Chairman for this ITTP COVID-19, but officially, I'm also the senior advisor of the Executive Office of the President of Republic Indonesia that involved in the beginning of the initiative to do the international teleconference on technology and policy related to COVID-19. Yeah, so can someone stop with the presentation first so I can share my, okay. Yeah, so colleagues, we has follow all of the presentation and information, important information from keynote speakers and also from important speaker, and that I expect that all of you will get full information about the vaccine COVID-19 and also why we are thinking the need to have the certificate, the health certificate or whatever the name, because remember that Dr. Aula mentioned that we have to discuss also in this webinar whether this is a vaccine certificate or the health certificate or the thing that we will propose during this presentation. Yeah, so this presentation will be outlined into background, objective, the survey information, and then also the standard operation procedure, the existing one versus the proposed. And we will talk detail about this proposed standard operation procedure, and then the proposed certificate in the IT system, and about the survey form itself. Yeah, there are some consideration why we propose this policy brief. So we got all the information how the limiting traveling during the pandemic has significantly given impact on the cross-country business, tourism, education, and a second home. But in other side, we also know that the free traveling, if it's allowed, has potential risk to increase spreading of COVID-19 in ASEAN. So in here, for example, not for example, but actually the ITTP committee team start to do the mapping of the current situation in the country of ASEAN member. So in here, we take the data updated on 20th April 2021 from all countries, and you can see in here that we still, we are still in the middle of the war. The active cases is still there, still here, still with us, and the new death also still happen. So we cannot ignore about this situation. And then, but we also know that the newest response for the COVID-19 pandemic is the national program of COVID vaccination. And Indonesia, for example, one of the first country who decided to start the immunization on January 2021. And this is also followed by other countries in ASEAN. And we can see in here from this slide that many people already vaccinated. Number of million people already vaccinated in ASEAN. But we also see that because of the population, some country, particularly for Indonesia, for example, because of the huge number of population, the coverage of people vaccinated is even less than 10%. So maybe only, less than Indonesia is less than 10, almost all is less than 10%, except for Singapore. So remember with what Dr. Aulia mentioned in the beginning of this webinar, that if we want to, until that the end of the vaccination, I mean, for example, to achieve the herd immunity or to achieve all the population vaccinated, maybe we need years to achieve that, when we know that the impact of the COVID-19 is happening and we have to really respond that very fast. So this policy brief, this policy brief or this policy recommendation actually is we conduct this to propose the development of SOP that secure interoperable system within ASEAN country members, so not only for single country, but in ASEAN country member, to enable ASEAN cross-country traveling activity for business, resident second home, tourism, and education with control COVID-19 risk. This is also by considering some concern that raised by colleague in previous comment. So in this time, I will introduce as an introduction, the survey on the implementation of what we call as an ASEAN Smart Mobile Certificate. So this is not the vaccine certificate. It's not about the vaccine certification. It's not about the health certification, but as reminded by Dr. Ronnie previously, that this is what the tool that we propose to enable people, to facilitate people for mobile within ASEAN country, but by reducing the risk. Yeah, so for this survey, there are some requirements. There are two basic requirements, ladies and gentlemen. The first requirement is that traveling shall only be allowed when the risk of COVID-19 is confirmed to be 0%. Again, remember in the beginning of this webinar, there are Dr. Aulia, if I'm not mistaken, saying there are 3 scenarios, and then we consider the the case in the origin country before the traveling, but also to see the country, you know, the capacity of the country to give a response if something that not expected happen because of for example, the increasing of the positive case. And another consideration is the additional requirement will be include the variation of cost, time, effort, data privacy, and security consideration. Remember also my colleague from University Indonesia really have a concern about the data privacy and security. The objective of this survey is to see, you know, the relation between the ASEAN country member and the proposed requirement, and then to see also the relation between the importance of the traveling and the proposed requirement, because we don't want that this tool will facilitate people to do the traveling with, you know, to do the traveling, but it's not really important. And then to see also the relation between the demography and the proposed requirement. Consider the explanation from a colleague from Pajajaran University, Dr. Eddie, that's saying that some people may be more vulnerable than others. So this is also to see that. The relation between the work field and the proposed requirement, and also the individual perception on cost, time, effort, privacy, and security. Because what we propose in here is also to, as much as possible, responsive to the need of the individual, to the need of the person who will do the traveling. Yeah, and there are 4 groups of participants: government, industry, university, and society, the civil society, individual civil society, non-government organization or association. So we will see the result divided by these 4 groups. And then there are actually the survey already conducted in the beginning when participants register for this seminar. But we will continue the survey during this webinar session, and hopefully after this, then we will see the result of this survey. Of course, that's not the end, because there are many others process that we have to do before the policy recommendation will be formulated and shared. From the survey, there are some section for the survey. First, of course, the identification, the ID of the person, to see the demography, and also to see the traveling history and plan, and the COVID-19 test requirement. So we talk a lot about this. And then the health risk assessment parameter, because we don't want this tool only for the vaccine certificate, but including also to see the health risk. And then the location of the tracking. So this is maybe something that very interesting, and then we can discuss further about this. Yeah, and still again, this is from the mapping that done by a colleague here in the ITTP. We see in here actually is the comparison of the existing practice as a traveling requirement, international traveling requirement, and then we will see the what we propose as a practice, and then in line with what shared by many experts in the beginning of the webinar, that we see there are three things, three requirements. The PCR test, as we know, as a recommended diagnostic test by WHO, and then the antigen test, and then also the quarantine. So there are three things. But we see in here that because in many countries, almost all of the ASEAN country member already have the vaccination program. So we see also in here the current practice for the requirement that apply to the vaccinated person and for non-vaccinated traveler. In here, for example, in the departure, almost all, it's applied for the vaccinated and non-vaccinated to do the the PCR testing 72 hours prior to the travel date. And the national health risk assessment also applied in all country. In Indonesia, for example, we have the E-HAC, what we call as a E-HAC. And also there is a requirement to do either the COVID antigen or the PCR test when the traveler arrive in one country. Of course, it's not happen in all country, but there is a practice to do either even the traveler already do the PCR test or COVID antigen before departure, but when they arrive, they also applied for the antigen and PCR test. And then when a traveler come to one country, then quarantine is applied with various numbers of days for the quarantine, but majority is 14 days for the quarantine. I think this already presented by Dr. Ronnie, if I'm not mistaken. But what we propose actually is when the smart mobility, the application we propose can be applied. What we propose is actually we propose to reduce. This is to limit, to make the travel required more strict. Actually, is the duration for the PCR test or the COVID antigen test result is 24 hours only prior to the travel date. It's applied both for the vaccinated traveler and non-vaccinated traveler. And then for the health risk assessment, we propose not just a single national health risk assessment, but what we propose is ASEAN, the uniform, the one platform, ASEAN Mobile Health Risk Assessment. And then another thing that we propose is if we can do these two things, so probably no need to do the test requirement or PCR test in the arrival when it's already done in the departure. This is applied both for vaccinated and non-vaccinated traveler. And then we also propose in here, even though we will discuss a detail about this, and then we will get when we got more information from you from this survey also about the quarantine. What we propose actually is quarantine is not really needed until, but tracking is needed until the test result obtained. Yeah. So, but this is also not just no quarantine, but we will see the zone, the risk of the people, the health status of the people, and then we will see using this the symbol of color. And then the standard operation procedure. So basically, the general requirement for the SOP is strengthen the health risk assessment, and then improve the public health safety, improve the comfortability, reduce the hurdle, increase the privacy, and ensure the data security. Yeah, this is, I think, we consider also many concerns raised by colleagues before this webinar, because we do some communication with colleagues, and also we listening the expert, what the expert saying, and also we note what the opinion from the representative of a country before this session. Yeah, and this is the proposed SOP. So like I said earlier, that we will use the symbol of color in here. Green color meaning this is the parameter that must to have. And then the yellow color is optional, but the red color we not recommend it. And then of course how we give the color in here by consideration, by considering the quality and accuracy of the three things: the PCR, the antigen, using the health risk assessment, the tracing, and then the quarantine. But also consider the time, whether this is need a long time to get the result, medium, short, or real time. And then the cost. This is also one of important consideration. PCR test, for example, we know that the cost is very high, while antigen is medium, it's still costly, but it's medium. But the low cost is for the health risk assessment and to do the tracking. Yeah, so we divided the requirement for the ASEAN departure and also for arrival. What we propose in here again for the, so again in here, so our recommendation, the must to do as a parameter is for the departure for the PCR test, antigen test, and health risk assessment, when for arrival is health risk assessment. So you will see in here that a health risk assessment is important. More detail about the health risk assessment, this is what we propose. So 14 days travel and health history to do the location tracking and health tracking, and then identify the sign and symptom. Like many of you already know this, the temperature, whether the fever is there or not, whether there is a short throat, diarrhea, cough, etc. And also the health data, age, BMI, the blood pressure, the heart rate, and then the oxygen level, and then the lifestyle to see the risk, like a smoker, drinker, sport, job, food type can be also considered. The medical history, because we're talking about the comorbid in here, we know this is the risk for the high case fatality rate of COVID-19, like the heart disease, diabetic, and the problem of immune disease, etc. And then the history of the rapid test, whether the traveler has got the rapid test, what type of the rapid test, how the accuracy and date when the rapid test is done. The same also for the PCR test, vaccine history, And we in here, we need to see the type of the vaccine, and then the date of the vaccine, and then also the PCR. Yeah, this is actually the proposed certificate design. So it will be the symbol color of the individual, low risk, for example, medium and high risk. This is the system that will be proposed in here. So Dr. Roni, I see in here that my remaining time is only 1 minute, but yes. Can I still continue for the survey? Yeah. So
Yes,
maybe it take longer.
Do it in 1.5
yeah.
minutes.
Okay, so my colleague, I will start with the survey. There is Google, what the Google form for this survey. Maybe some of you already fill in the survey, but someone who has not yet do the survey, you can click the link. I think it's already in the chat room or in the comment if you are in the YouTube. Yeah. So this is the Google form. Like I mentioned earlier, you need to click the country of residence in here only for ASEAN country, and then the age, you can just put your age in here, write your age in here, your gender, your designation in here, and then the institution, we need the institution like I mentioned earlier, because we want to see, we want to cluster the survey into these two groups, and then also want to know what is whether you have the history for traveling, or if you have a plan for future traveling, and then limit also the travel history in the last 5 years. Also the what is the objective of your travel in this last 5 years ago. And in here, we want to know whether you have a plan for visit any ASEAN country in the next 3 years, and what is the objective of the next visit. Yeah, education, business, tourism, or for the second home. And then continue for the section B. This is related with the preferable COVID-19 test requirement. So in here, this is really not from your experience, but from what your preferable applied for the vaccinated traveler and also for the non-vaccinated traveler. Yeah, and then from here you can choose actually, you can put the PCR test and also the antigen test, it's okay, but for each will be only one. And then the second is about the what the risk of factor, like the body mass index, the blood pressure, the heart rate, the oxygen concentration, whether this is needed or not. So just click in here, or you can choose a yes or no for each. And then the lifestyle, I explained already. This is the risk that probably needed to be assessed. Yeah, so put all the 4 risks in here, yes or no, and then the medical history in here.
Dr. Brian,
but yeah,
make a little bit faster.
Okay, so maybe not really necessary to read all one by one, yeah.
And then your slide is not still changing, it's still survey bitly.
Oh, sorry. Yes. I already opened actually.
Yeah, so we are a bit lost when you explain that. Please show it to us, and maybe within 30 seconds, so we can really catch it. Where is
so yeah, okay, so I think it's not easy to do the hyperlink from the presentation. So basically, you just open the Google form. Yeah. Okay. So do we still have time, Dr. Ronnie?
I honestly we have already, but you can share for fast, so everybody can really see that. No need to explain in details for every section.
Yeah. Okay. Okay. Yeah. So I start again from the beginning. So hopefully that participant also open the Google form. There are two sections. So we start with the section A. Yeah, it's better. Bigger. Make it bigger. Yeah. Okay. So what is your country of residence? Choose one. And then move to another question. Indonesia, for example, the age, okay, so put 19, for example, in here, gender, select one, put 40, for example, in here, and then gender. Just click, Jessica, you click the, yeah, the age, you put 40, for example, in here, gender, yeah. So, yeah, you can choose whatever. Yeah, and the designation, select one. Yeah, and then another is about the institution. Select one from these four options. And then the next question, do you have any traveling history and any future traveling plan? Yes. Do you have any travel history to any ASEAN country during last 5 years? Yes. What was the objective of your last visit during last 5 years ago? You can select, can be more than one. Okay. And then do you have any upcoming plan to visit any ASEAN country in the next 3 years? Saying yes, for example. What is your objective of your next visit? I will put, for example, education, yeah, or business. Can be also two, right? Yeah. Okay, so go, if you have finished with the first section, come to the next form. This is for the section B. This is for the requirement of the test, the requirement for traveler. Prior departure, for example, there in here for PCR, I will put the 24 hours PCR test for the vaccinated, for example, and also, yeah. Yes. Okay. No, there is a
Only
note
one.
in here. Only one. Maybe only for 24 hours. Yeah. Okay. Continue. Health data is one of the, this is about the blood pressure, whether this is needed to be involved in the health risk assessment. Put the BMI, yes. Blood pressure, yes. Jessica, yeah. Yes, yeah. Blood pressure, yes. Heart rate, yes. This is an example, yeah. Heart rate, maybe no, for example. Put no in here, just an example. So it's not always to say yes. And then the next question about the lifestyle. I want to put the, in here is about the lifestyle. For example, the smoking, yes. Alcohol, no. Exercise, yes. And working environment, no, for example. Yeah, and continue to the next question is about the medical history. Yeah, yes, in here, for example, if you think that medical history is needed to be involved, put yes. Or if you want to give any advice, other advice, you can also write down in here. Yeah. For example, in here, yeah, okay. And then number 5, proper vaccine administration data is important. This is about the immunization. So whether the type vaccine, yes, for example, in here to put the information about the type of vaccine here, and then the dose is important, for example, also in here, yes. The date of the vaccine administration also in here, yes. This is for example. And then question number 6. Yeah, this is about the quarantine, and then whether this is needed to be involved to be included in the health risk assessment. For example, in here, the date of test positive and negative of COVID is needed, yes. For example, yes. And then the hospitalization information, for example, I don't want, so put no. Yeah, continue. Rapid for the rapid antigen test, whether this is needed or not, yes. For example, type of the rapid test is important, put yes in here. Date of testing also important, yes. Yeah. And then the last, number 8 is about the PCR antigen test. It's not the last, yeah. The PCR, the information about the PCR, I think the time whether needed to be included. For example, yes, in here. Yeah. Date of test, for example, yes, important. So put yes for the date. And then question number 9, which yeah, this is about the which one do you prefer for COVID-19 test requirement at arrival room or non-vaccinated? Apa ini ya? Prefer COVID test requirement. Yeah, for example, in here COVID-19, this is when arrive, yeah. COVID, for example, the PCR test, this is when you arrive in one country. So whether you think that the COVID-19 test is required. One is about the PCR test. I will put in here, for example, for the vaccinated people, not apa ini? Yes, COVID-19 PCR test for the non-COVID and non-vaccinated needed in here, for example. Select non-vaccinated. Yeah. And then antigen for non-vaccinated, for example. For non-vaccinated. So yeah, okay. So we only can select one. So maybe Jessica put in here no PCR and no antigen rapid testing for vaccinated. For vaccinated but non-vaccinated, put for PCR test and yeah, for the PCR test, for example. Yeah, okay. And the next below is a few. Can you scroll down? This is the few sign, the sign of the health risk assessment when come. Put all, for example, this is put all the sign is needed. So yes for all. Temperature, fever, short throat, diarrhea, cough, and then other COVID symptom. And then another question, the next question, based on your opinion, which condition do you prefer for days quarantine implementation at travel destination? The number of the question when you arrive in one country, 3 days, 7 days, 40 days, or until the negative COVID-19 test result has been reported. For example, in here, for the just select maybe Jessica. Quarantine 14 days needed for non-vaccinated, for example, in here. Yeah. And then Ya, sudah. Yeah, and then number 12, based on the location tracking condition below, which one do you prefer during your traveling? There are 4 options: all time, at travel destination, only outside the green zone, only outside declared location, no tracking requirement. For example, I will choose no tracking required, for example. Choose one, right? So for example, I will choose no tracking required, for example. And then number 13, based on the health tracking condition below, which one do you prefer during your traveling at travel destination? In here, so for example, I will choose whether at least once a day, only when symptoms appear, no health tracking certificate when asked by the authority, maybe at least once a day. For example, I will choose at least one a day. Yeah. Okay, so if you finish all the 13 question, then submit this, click the submit. Yeah, and then our team will calculate the result. Yeah, so Dr. Ronnie, this is the Google form for the survey. I'll already presented. So I'm finished with my turn in here. Sorry to take long for the presentation. So I will give back the screen and time to you for the next presenter. Thank you very much.
Thank you so much, Dr. Brian. Very details explaining to us, and this is very informative for us to really understand what kind of the survey that we have been run, what kind of questions that we have been asked to the participants. And then for your information, we already got response for almost 500 respondents for this kind of survey. So we really expect that we can receive more. So more we receive the response, more comprehensive we can conclude, and then we can divine about the structure. Definitely it's one of your suggestion and opinion is very valuable for us. So do not hesitate, just follow the survey and fill. And then for the next speaker, we already have a very good friend from the other side of these countries, Dr. Masita. She is a scientific committee chair for social science in ITTPC 19. I'm very happy to welcome you today, Dr. Masita. Dr. Masita will present about what kind of description and then overview of result of the online survey that we have been conducted. So without further ado, Dr. Masita, time is yours.
Thank you very much, Ronnie. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera and good afternoon, everyone. So what I'll be presenting, this is not the survey that was conducted just a few seconds ago. So this was the online survey that was disseminated to everyone early this week. All right. Okay.
Pardon me. Yes, correct.
Yeah. Am I sharing my screen, or can I share my screen? All right, so I'll be presenting the survey results here. I hope everyone can see it. Yes?
Yeah, I can see that. Please,
okay,
Dr. Masita.
Continue. Where is it? Sorry, I can't. Okay. All right, so the objective of the survey is to seek feedback from the participants on the establishment of an ASEAN Smart Mobile Certificate for ASEAN Mobility, and the total number of respondents that was collected was 407. So for the response from in regards to the participants' background, majority hailed from university, 57.9%, whereas the other four stakeholders were from government, industry, NGO, or society. From the total industry sector, the participants, the three major industry were life sciences with 29.2%, followed by business 19.9%, and travel and tourism 16.1%. In relation to, when the question asked about travel history to ASEAN country, in total, 65% of respondents have had experience traveling throughout ASEAN country between 1 to 5 months, a year ago, and more than 2 years ago. And their previous traveling experience were mainly for tourism, 38.7%, followed by education, 30.8%, and business travel, 13.2%. So when the question asked about travel plans and the purpose for the next 2 years, 72.6% of the respondents do have plans to travel in ASEAN countries in the next 2 years. And majority of the respondents were looking forward to travel, mainly on tourism purposes, 60.4%, followed by education, 50.6%, and business, 24.7%. In relation to the question regarding the COVID-19 impact, majority of the respondents agreed that COVID-19 has affected in relation to the social impact, tourism interruption, study and education, as well as in economy impact. So you can see the breakdown of the percentages there from the graph itself. All right, in terms of the vaccination status, 56.5% of the respondents have not received the vaccination, which is equivalent to 230 participants, whereas 38.1% has received the vaccination in the past within the 6 months. Okay. Which type of traveling shall be allowed? Majority of the respondents agreed that education, business, and tourism traveling should be allowed with the ASEAN Smart Mobile Certificate implementation. So with education, majority is 85.5%, followed by business 76.4%, and tourism 60.2%. In relation to this question, in options provided for vaccinated people, which method do they prefer for effective travel management during the travel trip? 55.9% agreed the traveler should take both the rapid test at the origin and destination before travel to other country, whereas for the return trip, 54% agreed that the traveler should take both rapid tests at origin and destination before traveling to the other country. For the non-vaccinated traveler management responses, 72% of the respondents agreed to take the PCR test at origin country and repeat the rapid test at destination, whereas 70.8% of the respondents agreed to take the PCR test at departure country and repeat the rapid test at destination, which is the origin. In terms of the data and security, 91.3% of the participants agreed to use the ASEAN Smart Mobile Certificate for traveling, given that the security and privacy protection are well managed. And for the question, the last question was if the participants are interested to be involved with the team from ASEAN region to plan the implementation of Smart Mobile Certificate in your country, majority 81.2% of the respondents were interested to join the implementation team of the ASEAN Smart Mobile Certificate. So in conclusion, just to summarize everything, there were 407 total respondents. Majority of them plan to travel in the next 2 years, however, with unknown conditions of the pandemic. So this has affected them in their mobility. They also agreed to use the ASEAN Smart Mobile Certificate, and they think it will benefit majority of the sectors in terms of business, tourism, and education. So their major concern would be their data security, 91.3% of them, the implemented protocol and the standard operating procedure that will be implemented. Majority are also interested to join the team and to make this initiative a reality. So thank you very much. That's my presentation.
Thank you so much for sharing us about what we have been done in several weeks, days maybe, to get this data. And this is giving us a baseline information, how it looks like, the expectation of our peers and friends. And then for the next session, I will invite Professor Engineer Dr. Asli Yahya. He is one of the scientific committee chair for engineering and natural sciences ITTPC 19. So I'm very happy to welcome you today, Professor Asli. Time and place is yours.
Thank you, MC Dr. Ronnie. Can you hear my voice?
I can hear you clearly.
Okay, good, excellent. Okay. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And very good afternoon. I've been introduced by Dr. Ronnie just now. As a scientific committee chair for engineering and natural sciences for ITTP COVID-19, and I'm from University Technology Malaysia. Our distinguished guests, speakers, and participants, once again, welcome to the webinar of conference ITTP COVID-19. And this is the second half of the webinar after the break, and I'm the last presenter, isn't it?
Yes, you are. Last but not least, you are the most waiting by other participants. Please.
Interesting. Okay. Anyway, a very interesting topic and discussion from our speaker earlier. Their view actually have opened further clarification on the health certificate for traveling within ASEAN countries. So in line to that, on this pre-conference webinar, I'll be presenting the implementation plan of formulated policy brief, where the objective is to formulate a policy brief on the health certificate for Southeast Asian region, which will assist in enabling cross-border travel and consequently boost the economy recovery. So the plan considers national leader endorsement, Asian leaders joint agreement, registry and digital implementation, as well as Asian-wide enforcement for Asian traveling. Okay, I will request the Secretariat to share my slide because I'm not sharing anything. No, I think the slide is okay just now. Can you go back to the slide? Okay. Perhaps the first page after this. All right, okay. My talk today will focus on the implementation plan timeline, implementation team, and other related matters. Next slide. As you can see, actually we have outlined about 11 steps for the implementation plans. So I will go through each of them, but not in great detail since it is under plan consideration. So an implementation team has been set up since April and moving towards May 2021. If I may share some inside information on the establishment, of course, it's all started from the conference scientific preparation where we might conduct a monthly webinars. Some identified issue could be on the vaccine certificate, nutrition on complementary medicine, telemedicine, and telepsychiatry and public health data science. The other theme could be explored on the digital divide, business recovery, tourism, and psychological well-being. From the engineering point of view, we will embark on the low-cost renewable energy, power technology, transport technology, screening method, and telecommunication system. It is part of the conference committee that the advisory board may comes from the Asian or country leaders for all ministry, the steering committee from university, government body, industry leaders, a scientific committee from professor, researcher, as well as PG student for the organizing committee. Since then, we have quite a number of scientific committees come from Asian countries such as Brunei, Cambodia, Indonesia, Malaysia, Myanmar, Philippines, Singapore, and Thailand. Of course, the idea is to propose scientific solution for common COVID-19 problem in Southeast Asia. I hope it is sufficient on the conference background, as we will focus on one of the series of the webinars. Okay, can you go to the slide number 3? Okay, okay, all right. Okay, this is right. I'm sorry. Okay, let's get back to the plan. It is our intention to finalize policy brief draft somewhere in May until June 2021. At the same time, from May till August, we plan to have a discussion with ASEAN Secretariat as well as to obtain their support. In parallel, from May till August too, we will discuss with the Asian country member related to agencies as to obtain the support. Moving towards 2021, we're going to have a discussion with ASEAN Secretariat to obtain the agreement. And somewhere from September to December, we will discuss with Asian country member related to agencies as to obtain the agreement too. Can you go to the next slide? No, before that. I think this is correct. At the meantime, from June until September, we will customize supporting technology. Whereas in October until 2022, we will focus on the system integration. Hopefully by year 2020, the training will be imposed to all related agencies. And again, it should be implemented by all related agencies. Lastly, the monitoring, evaluation, and improvement will be fully conducted in the year 2020 until the end of COVID, hopefully. Okay, in the next slide, can you go to the next slide? We have prepared the representative form for the implementation team that may come from the first one, Brunei. Okay. However, the member is not limited to 3. Actually, we could have more participants. We can have participants from Cambodia, Indonesia, Laos, Malaysia, Myanmar, all the Asian countries. And hopefully, the secretary of the webinar will fill in the blank of the country's team members later. And I believe as this webinar is ongoing, some participants may have interest to contribute their ideas or knowledge towards the task. So you can reply to the chat then. Anyway, on the last slide, okay, this is the last slide. We may have to discuss on project and funding such as feasibility study, a standard survey and research, as well as the development project. And once again, this may require the Secretariat to have perhaps a separate meeting or discussion. Definitely any suggestion can be made through the chat. For that, I would like to end my talk with one hope that the pandemic will end soon, inshallah. Pass back to you, Dr. Rani. Thank you very much.
Thank you so much for really clear what we have been doing and what we will do for the future. Definitely, again, from the beginning, for the morning until now in the afternoon, we have a very prominent participants. Stay with us, 167 participants in the Zoom room and many also in the YouTube line. But the thing is, I try to draw a very big line that we are agree that health certificate is important. However, implementation need to consider several issues that what we are doing now in this room, discussing and constructing the best form for implementation for the future. But again, without denying that this important meeting is only be able to be run because of one of the locomotive and then prominent person behind of this event, which is unfortunately in the morning get interrupted by the signal, but now he is back with us. So before we close, because we don't have any Q&A session because we have it already in the beginning, I want to return the mic to Professor Eko, the chairman of ITTPC 19, the importance of this meeting and this webinar. We want to hand over the mic to you, Professor Eko. Any message, advices, closing remark to take home for all of us here. So time is yours, Professor Eko.
Okay, thank you very much. Okay, Dr. Roni. Sorry for this afternoon. Okay, electricity. So I think we got something that become very important for us. Okay, for all to work together. The key point here is basically to work together with a small effort. But okay, if we are working together, then hopefully we can have something that speak. So okay, I think this is okay. Just okay, my final options. Okay, the next I think the most important is the implementation plan. we hope everyone can work together and then yeah, fill up the form that we have already. And then also we have some homework that we need to do. We hope that until conference date, it means the 6 to 8 August, we can have something that is final. Yeah, but we have also homework, for example, to provide this material or this study result until now to the related institution or related agency that may need the result of this study. So I think that's all from me. I just would like to thanks to everyone that doing well today, and also stay with us until this afternoon. Is quite hard work also. And yeah, I think yeah, no else I can say. Thank you very much, and then have a very good times and happy Ramadan for Muslim. Assalamualaikum warahmatullahi wabarakatuh, and one day we meet again.
Thank you so much, Professor Eko. Thank you so much for everybody, to distinguished speaker, friends, participants. Thank you so much. So again, don't forget, we have the next session meeting in August. Stay with us. We have the website. Committees, would you mind to show us the website address so everybody who joined with us in the room can still access the information, following up the update and news. So please keep in mind, we are not finished yet. We are long run marathon together with you. We need you. Stay with us. Share your ID, give information, and then we can construct better future together, not alone, because we need to do it together, like Professor Eko also said. So again, committees, if you have some information about our website, Instagram, and then also Twitters, I think we have it, then we can share with the participant before we really close and dismiss the Zoom meeting today. Would you mind to share with us? I think this is important. Mr. Handy, would you mind to announce if there is no slide about that? Mr. Handy, someone of you, please.
What the heck of time? Hello?
Hello, yes, please, Mr. Handy.
Yeah.
Any website information want to share with the participants about the ITTP COVID-19 website address or Instagram, or we have a YouTube account or any others?
Okay. Maybe Ponyati can help me.
I think we have the website, right? So I'm not mistaken.
Yes,
we have,
yes.
yes. So yes, so this is the website. Don't forget to follow all the information, all the planning, and then all the important dates is posted in the website. So don't forget to often open it and see, and then don't be hesitant to contact with us. All the committee is very keen to collaborate and communicate with all of you. Again, on behalf of the committee today and all the support system, and then all with the best gratitude and greetings from Universitas Pajajaran, I'm the president of UNPAD and also organizing committee, and also friends want to say thank you so much for all your participation, all your patience. We are sorry if there is some misconduct or some improper things happen from morning, but I'm very happy showing that you are interested with the topic. Stay until the end with us. So again, this is only finished the first warming up session. So we will have a lot of session. So stick with us. Thank you so much. Salam sejahtera buat kita. Selamat siang. Thank you.
Don't forget to take a picture together.
Oh yes.
Take a picture. Yes, take a picture. Yeah.
So open the video and then the OC will take a picture.
Okay, I just move around in the house, so it's okay, right? So where should I get the background? Okay, it's quite dark here, so let's move the place.
Who will lead?
Okay, no.
Hey, wait for a second.
Who can spotlight? Yeah. Yeah.
Okay, to all participants, please open your camera because I will be taking a picture for documentation. Okay, for the first page, on the count of 3, 1, 2, 3. Okay, second page.
Freestyle.
Style.
1,
Can we
2,
jump?
3.
We can't jump.
Finish.
Okay,
thank you.
Thank you so much. Thank you so much. See you again.
Okay.
Thank you. Thank you.
Bye. Thank you.
See you in the next webinar.
See you in the next meeting.
Thank
and
you.
Bye. Thank you so much.
Bye.
Thank you.
Thank you, Dr. Rani, Dr. Kang Holis.
Thank you, Dr. Asli.
Thank you,
Bye-bye.
Bye-bye.
Thank you all. Thank you.
Good job. Good job.
Bye. Have a good weekend, everyone.
Thank you, Prof. Sabarina, also.
Yes, and Salam Ramadan.
Thank you.
Wait for another 3 hours.
Bye.
Bye.
Bye. Thank you, Dr. Asli.
Bye.
Thank you, Dr.
Congratulations to everyone.
Long day, huh?
Next will be you.
Long day,
Next will be you, Dr. Masita, right? You have
No.
Oh no.
No lah. I don't think we agreed yet to the fourth